school in India. It was renamed as JIPMER in 1964 and elevated to an institution of national importance in 2008. At any time, it has over 1,000 MBBS, 650 postgraduate, and 100 super specialty medical students. Outpatients and 2,000 inpatients daily in a high-quality hospital with 16 super specialty and 20 specialty departments. JIPMER campus of around 200 acres is the greenest among medical campuses in India. The institute is a leader in sustainable development and environment protection with a systemic water, energy, and waste management programs. Jawaharlal Institute of Postgraduate Medical Education and Research, also known as JIPMER, was started in 1823 by the then French government and was the first medical school in India. It was renamed as JIPMER in 1964 and elevated to an institution of national importance in 2008. At any time, it has over 1,000 MBBS, 650 postgraduate, and 100 super specialty medical students, 370 nursing students, and 210 allied health science students. It has a large 2,100 bed super specialty hospital. Its 350 faculty members and 4,500 employees serve over 8,000 outpatients and 2,000 inpatients daily in a high-quality hospital with 16 super specialty and 20 specialty departments. JIPMER campus of around 200 acres is the greenest among medical campuses in India. The institute is a leader in sustainable development and environment protection with a systemic water, energy, and waste management programs.
A very pleasant morning to one and all gathered here. A room full of curious minds, brilliant ideas, and a shared passion for medicine. What more could we ask for? I'm Tejaswini, your host for today, and on behalf of JIPMER, it's my absolute honor to welcome you all to the much awaited UG Medical Conference, Connaissance 2025. I extend my warm welcome to all our dignitaries, distinguished guest speakers, respected faculty members, and young minds from across the country. Over the course of this 3-day conference, we are thrilled to engage you in insightful expert talks, hands-on workshops, groundbreaking paper presentations, and various interactive sessions. The world of medicine is indeed limitless, just like the universe. And here, at the 7th edition of Connaissance, the theme Ad Astra Medica, Medicine to the Stars, reflects our collective aspiration to push the boundaries of healthcare, research, and clinical excellence to new frontiers. To begin this ceremony, we are privileged to have a distinguished panel of guests with us today. I now take the honor of inviting our dignitaries onto the stage. Our Honorable Chief Guest, Dr. Sanjay Zodpe, President, Public Health Foundation of India, Dr. Veer Singh Negi, Director of JIPMER, Dr. D.M. Thapa, Dean Research JIPMER, Dr. Vikram Kate, Dean Academic JIPMER, Dr. Ravi Kumar Chittoria, Acting Dean Academic JIPMER, Mr. Anurag Saurav, Organizing Secretary of Connaissance 2025, Mr. Aravind Ravichandran, Event Coordinator, Mr. Rangoon Mandal, Conference Facilitator. Your presence today adds immense value to this conference, and we eagerly look forward to the knowledge, insights, and inspiration you will share. Thank you. Now I request everyone to kindly rise for the invocation.
धन्वन्तरी स भगवानमृतत्वदाता यो वैद्यकस्य गुरुराधिरनाधिकालात् योगार्धदेहमन आत्मसुखावहस्य नैरोग्यतस्य नितरां च नृणां हितस्य तस्याहृणास्पदमहर्षिवरस्य शिष्य एते वयं प्रमुदिताननुभाग्यवन्तः तेन प्रदीपितचरं सुचिरात् शुभायुः वेदस्य दीपामिह तत्पुरतो धरामः येन प्रभां वयमिहस्य वितत्स्य दिक्षु ज्योत्स्नामृजार्तिशमनीं प्रभवेम दातुम् व्याधिव्यथार्थ हृदयाय हि मानवाय ध्येयं त्विदं भुवि करापि च न किलैषः ध्येयं त्विदं भुवि करापि च न किलैषः ध्येयं त्विदं भुवि करापि च न किलैषः
Thank you, everyone. You may now be seated. May the blessings of Lord Dhanvantri guide us in our pursuit of healing and excellence in medical sciences. To begin the 7th iteration of this annual undergraduate medical conference, I'd like to call upon the organizing secretary of Connaissance 2025, Mr. Anurag Saraf, to deliver the welcome address.
A warm welcome to one and all present here, esteemed dignitaries, distinguished faculty members, JIPMERates, and fellow participants. It is a great honor to welcome you to the 7th edition of Connaissance, JIPMER's annual International Undergraduate Medical Students Conference. It's a scientific and research fest that has become a defining platform for student-led inquiry, innovation, and discovery. Every year, Connaissance grows, not just in size or participation, but in what it represents. It has transformed into more than just an event. It has become a reaffirmation of our shared identity as an institution, which is committed not only to disseminating knowledge, but to creating it. Some of the most exciting strides in that direction are being taken by us, the undergraduate students. Connaissance has played a crucial role in shaping this journey of scientific curiosity. This year, the 7th Connaissance builds on that foundation. Over the next few days, students from across the country will present their work, defend their ideas, and engage in discussions that challenge and refine their perspectives. The spirit of learning, exchange, and collaboration will be at the heart of it. As we step into the next few days of debate, discussions, and discovery, I urge each of you not to just observe, but to engage and participate. These 3 days offer an array of presentations, workshops, lectures, quizzes, and expert talks that promise to broaden our horizons of learning, just like Art Astra Medica. None of this would be possible without the tireless efforts of our dynamic organizing committee and inspiring faculty. With the able support and guidance of our beloved mentors, we take great pride in being able to facilitate the exchange of ideas that befits these hallowed halls. With that, it's my absolute pleasure to once again welcome you all to the 7th edition of Connaissance, JIPMER's annual International Undergraduate Medical Conference. Thank you all for being a part of this with us. Thank you once again.
Thank you, Mr. Anurag, for your gracious words of welcome and for setting the stage for today's proceedings. I now request the dignitaries to step forward for the lamp lighting. I also invite the Medical Superintendent, Dr. Ellen Dorairajan, Student Advisor, Dr. Lata Chaturvedula, and our distinguished guest speakers, Dr. Samir Bhakshi and Dr. Madhu Shashidhar, onto the stage to join us in illuminating the lamp. Thank you. I request all the dignitaries to please be seated. I now invite Dr. D.M. Thapa, Dean Research JIPMER, to address the gathering and share his valuable thoughts with us.
Good morning, respected chief guest of today, Dr. Sanjay Jodpe, President of Public Health Foundation of India, our beloved Director, Dr. V. Singh Negi, the Dean Academic, Dr. Ravi Kumar Chutaria, the students who have organized this conference, the Connaissance 7th edition, Dr. Anurag Saurabh as organizing secretary, and the other co-coordinators, Dr. Arvind Ravichandran, dignitaries of the dais, our medical superintendent, Dr. Alan Durerajan, and the special guest speakers who have joined us, dear students, faculty members, ladies and gentlemen. It's really a pleasure for me to stand before you for this 7th edition of the Connaissance. This is truly a hard work by our students who are putting up this event of this magnitude with over 2,000 delegates assembling in the gathering. We have distinguished speakers from across the country and an atmosphere buzzing with scientific activity and curiosity. We know that the science develops on the quest for query or inquiry, one can say. We have seen that this conference have grown by leaps and bounds year after year. The first edition of this conference was held in 2017, and the next conferences happened rarely till COVID struck, and then we returned back with a more promises to fulfill for the students. The students have put a lot of efforts along with the faculty members and the organizing team to put up this show. And I hope the students will relish each and every moment of, because there are many components of it. There is a workshops, there are debates, there are quizzes, there is a assembly, there are so many things which are happening on a day-to-day basis. And then you have the keynote address today, and then the scientists who are speaking to you and inculcating the habit of inquiry. We in JIPMER, we have, for the student research, have dedicated G.J. Strauss Awards. Initially, they were 13 in numbers. We have increased them to the 14 in numbers. And this has been done with the concurrence of our current director, Dr. V. Singh Negi. I hope that with this atmosphere of the things which are created in JIPMER and research and innovations being put in the front. So a new type of JIPMER will come into vogue. There will be a number of other things which will be happening. You will have a networking and social gathering, and you are in a place called Puducherry, which has a historic background because it was a French colony. And this school, JIPMER, also evolved as a École de Medicine in 1823. I wish the participants and the delegates and all the organizing team a resounding success. To the all present here, this is a platform for your opportunity to explore and find new ways of learning, because case presentations is also part of it. Make the most of it, engage, question, and innovate. Thank you, one and all.
Thank you, sir, for your inspiring words. Your engagement strengthens our commitment to making Connaissance this year a valuable and enriching experience. Now, it is our privilege to invite Dr. Veer Singh Negi, Director of JIPMER, to address the gathering. Sir, we request you to kindly share your words of wisdom with us.
Good morning, everyone. The esteemed faculty members, dear students, distinguished guests, both on stage, off stage, and participants from across the country. It gives me immense pleasure to welcome you all to this Connaissance, the 7th annual Student Scientific and Research Fest held at JIPMER, Puducherry. I congratulate the dedicated organizing team of students for their hard work, which is culminating in this scientific and academic feast for the benefit of all the participants who have gathered from all over India. Connaissance is not just about scientific posters and presentations, but it is an opportunity for every student to take their first steps in the world of scientific discourse. During my career as a teacher and researcher, I have seen the next generation of researchers, teachers, clinicians, and thought leaders being forced through the rigorous training of what we call as training in medicine. It is in this spirit of academic excellence and scientific inquiry that we are deeply honored to welcome this year's chief guest, Professor Sanjay Zodpe, to JIPMER, and I consider it a privilege to introduce him. Professor Zodpe is a renowned person in the world of public health and epidemiology. He currently serves as the president of Public Health Foundation of India, an institution that ranks second globally among schools of public health all over the world. A physician, an epidemiologist, and an academic leader, Professor Zodpe has not only helped shape policies, but also reimagined how public health is taught and practiced in India. He has played a pivotal role in establishing various institutes of public health across the country. An alumnus of Government Medical College, Nagpur, Professor Zodpe holds degrees in medicine, public health, sociology, economics, and public administration. He has received honorary doctorates from both India and international institutions for his outstanding contributions to global health. In recognition of his outstanding services during the COVID-19 pandemic, he was honored with COVID Warrior Award, a testament to his dedication, resilience, and self-contribution during one of the most challenging public health crises of our times. Sir, we are honored by your presence today. Welcome, sir. Before I conclude, a quick word of advice, if you call it, for the participants. I urge the participants to please utilize the conference activities to improve knowledge, to ignite the spark of scientific quest. For this, you can just walk into any session you know nothing about attend a workshop just for fun, talk to participants from another college, interact with each other. Who knows, you may carry memories of a lifetime when you go back. Thank you, and Jai Hind.
Thank you, sir, for your insightful address. Your emphasis and encouragement on research and innovation truly inspires us to strive for excellence in this medical field. As we proceed to the next segment of the inaugural, it's now time for the much awaited keynote address by our esteemed chief guest, Dr. Sanjay Zotpe, the President of Public Health Foundation of India. On this momentous occasion, it is our honor to welcome our esteemed chief guest with the bouquet. I request our director, sir, Dr. V. Singh Negi, to kindly come forward and present a bouquet as a token of warm welcome. Thank you, sir. Ladies and gentlemen, please welcome Dr. Sanjay Zotpe.
Very good morning to all of you. Thank you, sir, for that generous introduction. Honorable Director of JIPMER Pondicherry, Dr. V. Singh Negi, Dr. Thapa, Dr. Ravi Kumar, distinguished faculty, academic leadership of JIPMER Pondicherry, student leaders, the students who have traveled across the country to participate in this exemplary program here, and ladies and gentlemen, I would say that this is an extraordinary privilege for me to participate in this program and share some reflections and thoughts with all of you. You are the future healthcare leaders of this country. And there are tremendous expectations from all of you. You are the custodian of the health of the population of this country. Some of you would travel globally and would also contribute to the global health also. And from that perspective, what is important and critical to understand that from the health front, where do we stand today in the country? As a country, as India, as a nation, where do you stand on the health front is important to understand. Because when we design a strategy, we really need to see that where are we today? Where do we want to go tomorrow? And how do we go there? And from that perspective, I thought that I will share some numbers with you. The average life expectancy in India is around close to 70 years or so, which is the second lowest in South Asia. We're just a nose ahead of Pakistan. Our infant mortality rate has dropped down very considerably over the years, particularly in last 10 years or so, to 27 per 1,000 live births. But it doesn't really well compares with 8 and 9 in Sri Lanka and Thailand. Several countries in the region have a single-digit infant mortality rate. Non-communicable diseases are emerging. Unfortunately, we are labeled as the diabetes capital of the world. We have a very strategic program and top-down leadership pushing the agenda of tuberculosis prevention and control. Still, we harbor significant number of tuberculosis cases and even mortality associated with tuberculosis and other infectious diseases. We have made a tremendous progress in our healthcare services in the context, like, for example, immunization, our rates are pretty high. But then, even when the civil conflict was in Sri Lanka, those days also it was more than 95%. We are still yet to reach to those numbers. And if you look at the inequities in the context of immunization rates, lowest income quintile and the highest income quintile, you would have almost double the difference of the immunization rates. Tobacco is attributed to more than 1 million deaths annually every year in the country. Air pollution contributes to 1.6 million premature deaths in India, which translates to 49 million disability-adjusted life years, which is certainly unacceptable. If we look at the health expenditure in the country, is around the government of India spends on our health is around 1 to 1.1 to 1.2% of the GDP, which is half of Sri Lanka, fourth of China, and sixth of Thailand. So long way to go there also. Our national health policy very clearly articulated that we need to spend around 2.5% of our GDP by the government of India on the health of the population of this country. But that's quite a far dream that for all of us. We also need to recognize that why I'm talking about these numbers is to give an idea about where are we today. And we really wanted to position our country globally, but more importantly, to ensure that we have a healthy population. We will have to slog hard in coming decades. And that's the more accountability and responsibility lies with all of you. You are the champions, you are the future leaders of this country. And from that perspective, you need to recognize that these are the challenges that we have. And we must also recognize that our national bird is peacock and not the ostrich. If we really wanted to fix our problems, we'll have to look around, where are those problems? And then try to articulate and design strategies and policies to see that we improve our population health. And that's the responsibility, a huge responsibility that lies with all of you. I would like to congratulate the organizers and particularly the leadership of JIPMER Pondicherry for organizing such conclave over the years that I learned, which provides the platform for discourse, deliberation, and disquisitions in some of these issues as the young leaders in the field of medicine. And I'm sure some of these discussions and deliberations will help you to take back some dreams with you to contribute more effectively and significantly advancing larger agenda of population health in the country. I also wanted to mention that for all of you, there are tremendous opportunities. We are at the juncture. There's a lot of developments happening because we never wanted to see health in isolation or medicine in isolation. You would recognize that the health of the population or health of the people is impacted by several factors which are beyond the corridors of medicine and health. Let's take an example of, suppose, climate change and health. The impact of climate change. I just gave numbers of air pollution for that matter. Even the taxation policies of the government, they impact all our health. You know, the taxation policies for tobacco or alcohol or sugar-sweetened beverages, they all impact on our health. Professor Michael Marmot tells us that the conditions in which we born, live, grow, work, and age all have influence on our health. And therefore, truly, there are many sectors which needs to be also connected, even though we work in the health sector, to advance the larger agenda of keeping populations healthy. And therefore, the multidisciplinarity is so critical and important. And when we practice medicine, when we are the students of medicine, we must recognize that we are the integral part of this society. And therefore, always at the back of your mind, you must consider what are those social determinants, what are those commercial determinants, which also play an interplay in the context of the health and population. Because medicine is an instrument, medicine as a profession is an instrument to keeping populations healthy. And we must recognize that we are the tools and instruments for propagating that whole philosophy. Therefore, from the perspective of multidisciplinarity, we also need to think in the context of interventions that we plan should be multisectoral also. And when we come to interventions that we talk about for advancing medicine or health, they should be evidence informed, because we need that evidence that's to be created, which will inform the even clinical interventions or public health interventions or any kind of interventions for that matter. So evidence informed. It is also equally important that they are equity promoting. As I mentioned and gave an example of immunization rates, as in the lowest income quintile and the highest income quintile, a girl child born in Chhattisgarh or Madhya Pradesh in this country is 8 times more likely to die as compared to a girl child born in Kerala or Tamil Nadu. So in the lottery of life in India, it matters where you are born as a girl child. So these are the stark differences that we have. And therefore, the interventions that we think about should also be equity promoting. So always keep in mind impact, equity of the work that we all do. It should also be culturally sensitive and context relevant. The work that we do in the field of medicine should be culturally sensitive and context relevant, but robust by design and resource optimizing, because we have limited resources. We are still a developing country and we are emerging to be a leading power in the global, but then still we have limited resources to really see that how these interventions that we promote, it could be clinical interventions, public health interventions, social interventions, are aligning with the evidence-informed, equity-promoting, context-relevant, culturally sensitive, also robust by design and resource optimizing. That will really help us if we keep that in mind in moving forward, the advancing the larger agenda of health. One also needs to keep in mind the competencies are so critical and important. On one hand, knowledge is important, but that knowledge needs to be translated into action, and therefore we need competencies. We know the changing ecosystem in the country and a lot of focus on now the postgraduate medical examination. And the focus for the undergraduate students at times is much more knowledge oriented than acquiring skills and competencies. But you please remember, you will always be recognized only for your skills and competencies, and we call them as hip pocket competencies that you must have. And when we say competencies, not only the technical competencies are important, as tomorrow you will be surgeon or tomorrow you will be physician or ophthalmologist. Of course, the technical skills that you will always be recognized. But one also needs to recognize as a student, undergraduate student, postgraduate student, to acquire those soft skills which we say that the professionalism or the critical thinking for that matter. To think about the issue, reflection, analytical ability, so all these will help you to create your own signature. So when you focus on the acquiring of the technical skills, I think 10%, 20% of time that we must spend on also acquiring those soft skills of like how you can be a better communicator, both in writing and both in verbal communication. How you can develop a capacity of reflecting unbiased way on some of the critical issues, critical thinking, professionalism. All these are simple things in life which actually will make you a good doctor, a good physician, a good surgeon. So complementing those technical skills, we must spend time on some of these skills which are also important and critical. I'm a very strong advocate of promoting and propagating reading habit. I know that you are an undergraduate student and, so you read all your textbooks and reference books, and that's fine that we must read medicine and reading is important. But I think non-health, non-medicine books, we must read at least one book in 2 or 3 months. You must read something which has nothing to do with medicine or health. And you start reading books 5 years down the line, I tell you, you will be a different person. Because that actually matures your thinking. That brings you read sociology, you read world politics, you read diplomacy, you read whatever you want to read, but you read something outside the parlance of medicine and health, and that would definitely make you much more richer in your understanding and finding connects, because we are actually a social animal, we are part of the society. We really need to understand what's happening around the society. That would help us also you to evolve your critical thinking and analytical ability of looking at the issues. Because from the health sector, what matters is that we should be able to define the problem, finding the solution to the problem, implement that solution, and then see that whether it works or not, whether even it's in clinical practice or in any other matter for that matter. From that perspective, I'm a strong advocate of promoting reading. I generally read a book a month or 6 weeks. And it's important that, you read and then you feel that you are enriched. And I am telling you again that you start reading and then you will see that 5 years down the line, you are entirely a different person. We also need to focus upon the education that currently undergraduate education. We have some senior faculty also here sitting, because we must recognize that if you look at the levels of education and learning also, informative to formative and formative to the transformative learning, which is so critical and important. Because we recognize that informative learning would help us to acquire the knowledge and skills. Well, it's information, it's knowledge, it's skills. But the formative learning and formative education will add to that the values and ethics and morals, which are so critical and important. But we also need to go one step further forward from informative to formative and from formative to the transformative education, because the transformative education helps us to create and actually acquire those leadership attributes which are so important. Because informative learning would create experts. Formative learning will create professionals, but the transformative learning will create change agents in the society, the leaders in the society, and that's what exactly we expect from all of you to be our future leaders. And therefore, we will also have to systematically, strategically, and consciously engage in both institutional and instructional reforms in our medical education also. And from that perspective, I wanted to shift now from education to the research, because knowledge is more important. Knowledge. Well, research is merely a tool. What ultimately benefits to the society is the knowledge that we create. And when we say knowledge, it has two components: knowledge generation and knowledge translation. So research is a tool for generating knowledge, that it generates the knowledge. But knowledge translation actually gives you the thrills of the discovery, that you feel happy about it, that, I applied this knowledge in my clinical practice, that I benefit to my patients. So the application of knowledge is so important and critical. We must recognize that science is sterile if it lacks the social relevance and purpose, and policies would crumble and cliff it if they are not firmly placed on a pedestal of valid science. I repeat, science is sterile. If it's sterile, medicine is science. If it lacks the social relevance, so we really need to see that how it connects with the social relevance and social purpose. And the policies would crumble, which are based on the science, if they are not firmly placed on the pedestal of valid science. From that perspective, you always need to keep in mind some of these issues which contributes to the society. Having said that, there are no shortcuts, and particularly in the field of medicine, that you must be seeing your professors, teachers here. They have actually tremendously hard worked over a period of time, couple of decades, 3 decades, and 4 decades, and then they have been able to create the stature and signature that they have. Because we all create our own signature over a period of time, through our conduct, through our behavior, through our practice, through our intellect, through our communication. And that's how we all create our own signature. That we talk about, like Professor Negi, and then you say that, he's a director of an institution. So you have an image of Professor Negi, which has been created over a period of time. And, we have seen him over a period of time. And that's how actually we emerge as, in the life. And from that perspective, for creating that signature, we have to always be conscious about our conduct and our behavior and our intellect and knowledge, acquiring new skills, keeping updated. Those are the important things which tells us that there is no shortcut to any kind of work that we wanted to really do. I would say that very quickly and briefly, when I was a medical student and when I was final MBBS, then that time I had interest in community medicine. And then I was in dilemma also. I was also wanting to do ophthalmology, and then I was debating whether I should do this or not. And then while actually doing internship, then I realized that the community medicine as a discipline, and then subsequently we call it some multidisciplinary public health also, that the impact point of view, we can do much more. Like as a clinical medicine, that you treat one patient, but you feel so happy that you treated, you saved the life of people, and that's an important. But in public health, our beneficiaries are nameless and faceless. We really do not know who is benefited by the public health interventions, but they are in big numbers. From the impact point of view, from the equity-driven point of view, I always felt that that's a right approach of actually advancing larger agenda of public health. I also know that there is a fierce competition, because as an undergraduate program that you would be finishing and then appearing for postgraduate entrance examination, and then you may have a dream and desire that you wanted to pursue medicine or surgery or ENT or any other discipline. But we really need to see that the number of seats available for the postgraduate program, although in last 10 years there is a tremendous increase in number of seats, I would say both at undergraduate level but also at the postgraduate level. But still, some of you will have situation where probably you would not get the branch of your choice, or you won't get a clinical the discipline that you wanted, and then you might be thinking, what should I do? I think sky's the limit in life. You don't have to really worry about it. Suppose you wanted to do medicine, you get medicine, that's great. Obviously you do medicine and then subsequently cardiology or something that you wanted to do. But if it doesn't work, then there are other options also to contribute very significantly. Public health is one of them, but you can think about many other options that one could be, available for that purposes. It's not necessary that sometimes it's not that whatever you wanted in your life that you will get. Despite your hard work, despite your commitment and determination, it may not work around actually. But keep always in mind, one door closes, another door opens. It doesn't mean that you have to be too much worried about the life. What actually ultimately matters is that at the end of the flag life, everybody would compare to see that, have I lived my life satisfactorily, professionally, contributed significantly? That's more important than the materialistic achievements in the life are concerned. From that perspective, one has to think about it. To conclude, I also wanted to say that we really need to work in this country. When I started actually enlisting some of the problems of the country that we are facing right now, that we really need to advance the health assurance. And what is the health assurance? You always keep in mind that I have to work about the health assurance. What is this health assurance? There are two words. It is the assurance to the people of this country. It is the assurance to the people of this country about their health, the health they dream, desire, deserve, and demand, because we live in a democratic society. And from that perspective, always keep in mind that, am I contributing to this larger agenda of health assurance? And that when we deal with the patients, when you work in the public health or any other discipline, that would really help you to really move forward, which will help us to create not only Swachh Bharat, but Swasth Bharat, Smaksh Bharat. Thank you so much for this opportunity. I interacted with some of you when I was on flight also, and some young girl was sitting next to me on the flight, and she checked with me. I had yesterday evening, some of you met me. I interacted with some of you. I cherished conversation, and I hope you also cherished some of the reflections and thought that I shared with you. I'm grateful to the JIPMER leadership for inviting me here to share my thoughts and reflections. Thank you so much.
Thank you so much, sir, for your enlightening and thought-provoking address that will surely inspire us to strive for excellence in our medical journey. May you continue to inspire millions of young minds and doctors across the country. Now, as a token of gratitude and respect, I invite our director sir to present the chief guest, Dr. Sanjay Zolpi. After JIPMER, we are also extremely delighted to present the chief guest with a portrait made by one of our students as a souvenir. Next, we extend our appreciation to our Director Sir for his unwavering support and leadership throughout. I invite our Organizing Secretary, Mr. Anurag Saurav, to kindly felicitate him. A conference of this magnitude deserves to be chronicled. And what better way than through our very own Connaissance magazine? And I'm also thrilled to share that this year we revived the tradition of drafting our Connaissance magazine again after the COVID pandemic. To mark this special occasion, I now invite our dignitaries to unveil the Connaissance 2025 magazine. This magazine stands as a testament to the efforts and dedication of the entire team behind Connaissance 2025. Once again, a huge round of applause to all the magazine editors and the team behind Connaissance. With that, we've come to the end of the inaugural ceremony. Every successful event is a result of teamwork, dedication, and relentless effort. To express our gratitude to all those who contributed to the event, I now invite Mr. Aravind Ravichandran, Event Coordinator, to deliver the vote of thanks.
Respected Director, esteemed faculty members, distinguished guests, and my fellow student researchers. As we conclude this inauguration of Connaissance 7.0, it is my privilege to extend a heartfelt vote of thanks on behalf of the organizing team. We are deeply grateful to our chief guest, Dr. Sanjay Zotpe, for taking time out of his busy schedule to share some of his most brilliant insights with us. We also wish to express a sincere thanks to our respected director, Dr. V. Singh Negi, for his unwavering support. Sir, your vision for student-led research and innovation continues to motivate us, and we are truly grateful for your encouragement. A special thank you to Dr. D.M. Thapa, Dean Research, and Associate Deans Dr. Prasad Ganesan, Dr. Subita L., Dr. Nishat Plakal, Dr. Vikas Menon, and Dr. Ravikumar Chitoria, the Acting Dean Academic, for providing us with the guidance and infrastructure that make an event of this scale possible. Your belief in student-driven inquiry has helped foster the research culture that we are proud of today. To our guest speakers, panelists,
Judges, we sincerely appreciate your time, expertise, and willingness to engage with young minds. Your insights will undoubtedly shape the perspectives of our student researchers. A huge round of appreciation for the organizing committee, editorial team, and student volunteers whose dedication and hard work have brought this event to life. From planning logistics to ensuring smooth execution of every little detail, your efforts are what constitute the heart of the event. Last but certainly not least, to all the participants and attendees, thank you for being here, for your enthusiasm, and for making Connaissance a space for meaningful exchange. Your curiosity and passion are what make this event memorable year after year. As we embark on the next few days of research presentations, discussions, and learning, I encourage every one of you to engage, collaborate, and explore. Let this be a platform not just for sharing knowledge, but for sparking new ideas, forging connections that extend beyond these halls to make friendships that last a lifetime. With that, I once again express my sincere gratitude to each one of you. Let's make Connaissance 7.0 a memorable and enriching experience. Thank you.
Thank you, Mr. Arvind, for your kind words of appreciation. With that, we officially conclude the inaugural session. You never know which conversation, which idea, or which session might inspire your next big breakthrough. So, stay curious, stay engaged, and make the most of this experience. Enjoy the conference and let the journey of Ad Astra Medica begin. I request everyone to stand up for the national anthem.
गणमनाधिनायक जय हे भारत भाग्य विधाता पंजाब सिंधु गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्छल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Thank you, everyone, for taking your time to be with us today. I request the audience to please be seated. The refreshments for the dignitaries have been arranged in the dining lounge. Students can proceed to the dining hall for refreshments.
ஸ்பீக்கர் எடுத்துட்டீங்களா? ஸ்பீக்கர் ரிமூவ் பண்ணிட்டியா? ஸ்பீக்கரும் வரல. ஸ்பீக்கர் மியூட் பண்ணிட்டு பண்ணா that I've chosen today is how to choose your research topics. And I'm going to share what I have learned over time. So I started my journey at JIPMER Pondicherry right here. And I had no idea about research that time. I didn't ever think that I'm going to go into research. And soon after completing MBBS, I joined AIMS New Delhi. And even at that time, I had no idea or no thoughts that I would do research. I did do a randomized controlled trial as my PG dissertation. I published it, but even then, I was not fascinated by research. But one thing that I wanted to do was learn about thalassemia and stem cell transplants. While I was at JIPMER, I didn't have the opportunity to see thalassemia because thalassemia is not common here. When I was at AIMS, the Department of Hematology had become a separate department, and we as residents did not rotate through that department. So I did not see thalassemia. And I said, okay, I will learn transplants when I go to the US. I gave my US MLE and headed for the US. I landed up in Detroit, Michigan, where I was trained. But even in US, I did not see thalassemia because thalassemia was not there, and it was sickle cell anemia that was there. So after doing my oncology training there, I was contemplating to do a 1 or 2 year training in bone marrow transplants, but two things happened at that very time. The first thing was that for chronic myeloid leukemia, which at that time was the major indication for allogenic transplant, the wonder drug came up, that is imatinib. And that changed this disease right from, so this disease is treated the pill to be taken and nothing else. And the lifespan is like that of any other individual who doesn't have cancer. Then there was another thing that happened right at the time when I was in my training in the US, the Bezwoda affair. And I call it an infamous Bezwoda affair. What happened was that Dr. Bezwoda got a session to talk in the year 1999 in ASCO, which is the American Society of Clinical Oncology. And he presented that for locally advanced breast cancer, if you do stem cell transplant, the survival will be enhanced. And the world then started doing bone marrow transplants for advanced breast cancer. In fact, as a full company, the maximum transplants that I did were for women with advanced breast cancer. The interest in transplant was really growing as a career, but unfortunately, the data was examined and was found to be forged. Thousands of women across the world underwent a stem cell transplant because of forged data by Dr. Bezwoda. I was confused and I thought that is transplants being done only because people want to just do it as a career, or is there actual interest in transplants? Then I spoke to one of my teachers in US, Dr. Ravindranath, and I asked him, I'm confused. And he told me, Samir, you become an expert of the disease and not of the procedure. If you become an expert of the procedure, then you like to fit everything into that procedure, no matter what the disease is. So this line struck me very well, and I decided to pursue my career as an oncologist and not as a primary transplanter. After completing my training, I moved back to India, and from Detroit, after spending 5 years in the US, I came back and joined as faculty in the Department of Medical Oncology at the All India Institute of Medical Sciences. This was in 2002. Even then, I was not into research. I didn't think that I would choose research as one of my interests. And I remembered Dr. Professor M.K. Bhan, who is no more, but just let me tell you a line about Dr. M.K. Bhan. He is the pioneer and inventor of the current oral dehydration solution that is used today, the low osmolar ORS. He's also the one who brought the rotavirus vaccine. Perhaps if I were to say, he is the biggest physician researcher India has produced till date. When I was a resident, he asked me a question about common causes of diarrhea, and I rattled out. And he said, no, Samir, this is not correct. This is not our experience. And as a resident or student that time, I could not have thought that what is written in Harrison could be something different from that the experience matters more than what is just written in the book. So he had actually put the seeds in my mind that you have to look at what your experience is. And that one statement during my training carried forward. And then when I became faculty, I looked at what was the local experience. In India, we had a different epidemiology of cancers than what I saw in the US, different stages of disease. We had far more patients and very few beds to handle those patients. Financial unaffordability of several modern molecules. And I thought that these would be my challenges, and I wanted to convert them into opportunities. And obviously, one wants to do simultaneous cutting-edge research as well. Let me just give you one example of one disease, how it was different, and how some of my people thought that time. So retinoblastoma, a tumor of the eye, the whole world at that time was looking only at disease. But at All India Institute that time, around 1/3 of the patients were still presenting with eyes with locally advanced retinoblastoma. And the treatment at that time was examination in several centers across the world. Then, one of our residents, Dr. Venkatraman Radhakrishnan, who is currently the head of medical oncology at the Adyar Cancer Institute, who was working with me, we decided that we would look at the concept of adjuvant chemotherapy in advanced retinoblastoma. That was our problem and nobody else's. The people in the US and Europe would not have worked on this because the problem was not there. We worked on it, able to convert exenerations into enucleations, a big change in the way this disease was treated. We also looked at PET scans that time, and we were able to show that if you have uptake in the optic, every single patient ends up dying, and we started intrathecal therapies for those patients. So my point that I wanted to make for you was that choose a topic of research which is relevant for you and not something which is flamboyant across the world. What you see matters more. The next problem, or I would say problem, just one of the issues that we had to deal with was patients and few beds. Those, as a medical oncologist, one of the things that we face very commonly is we give chemotherapy. There is a risk of severe infections, which is called as febrile neutropenia. That's considered as a medical emergency because if you don't treat, you can lose the patient. And normally the trend, the policy is that you start IV antibiotics and you continue to the blood counts recover. The febrile neutropenia is classified as low risk and high risk. Low risk meaning that you know that the neutropenia will recover in 7 to 10 days, and high risk, something that you would face in acute leukemia well, you know that the recovery will take up to 3 to 4 weeks. So we have two kinds, low risk, high risk. So at that time, we had very few beds. We were unable to admit, and we decided that we will explore the option of intravenous antibiotics versus oral antibiotics in febrile neutropenia on an outpatient basis. And we were able to demonstrate that outpatient management of low-risk febrile neutropenia is feasible and that oral antibiotics are safe and we can give it safely. We went ahead and we did a second trial thereafter that after recovery, after the fever gets better, even if the blood counts are low, we said we will stop antibiotics and see what would happen. And the two arms were absolutely similar. We were able to show that once you start antibiotics, the fever recovers. You have to wait for the recovery of counts. The outcomes are similar, and we were able to show that we can save costs with no compromise on outcomes. We have extended this, the randomized controlled trial, on high-risk febrile neutropenia, and the work has just concluded 6 months back. This trial took us more than 6 years to complete because we had to recruit more than 300 patients in this trial. I can, while the data is not published and not even published as an abstract, I can just share that the two arms were similar. We could stop antibiotics once the fever recovered, even if the blood counts were low. Even if the ANC was 100 or 0, you could stop antibiotics safely. So what I wanted to stress from these examples were that our challenges resulted in less beds were needed. We were able to show that less antibiotics are needed, more nosocomial infections, and we were able to lower costs. Now let me come to another area, unaffordability of modern molecules. How many of you know the word Cooley's anemia? Thalassemia, right? This is Dr. Cooley, but he's not Dr. Thomas Cooley. He's Dr. William Cooley. He was an orthopedic surgeon in the current Memorial Sloan Kettering in New York. And while working as an assistant professor in the late 1800s, he found that some patients of sarcoma got better on their own when they had infection locally. He was intrigued by this observation. So he started injecting bacteria around soft tissue tumors. Imagine he did this back in late 1800s, early 1900s. And he still succeeded partially. He was not convinced. And from orthopedic world, he went to the lab. He started working in the lab, and he's actually the pioneer of cancer immunotherapy. The factor that he worked on later on came to be known as tumor necrosis factor alpha. Almost 9 years back, there was a full issue in the journal Science about cancer immunology and immunotherapy, and today it's a standard therapy that is used. You know, the same cancer with the same genetics, same molecular features does not behave the same in every individual with the same treatment. So there has to be something different. And that difference probably is the immune system of the body. So there's a constant fight between the immune system of the body and the cancer, and whosoever wins the battle. So that's the concept of immunotherapy. So let me tell you, the cost of this therapy currently in India would be around 6 million rupees annually. And the average household income in India is, as per the 21-22 data, is 150,000 annually. So obviously, if 6 million rupees have to be spent, majority of the families would not be able to spend from their pocket. The answer is very obvious. So Tata Memorial Center brought out an interesting study of low-dose immunotherapy, and they were able to show that that also works. But the cost still is more than 300,000 per annum, which is also more than twice of what is the average household income of an Indian family. Few years back, we worked on this instrument. This, how many of you play music in this hall? How many of you play bands? Okay, there are some hands going up. So this is a metronome, which gives a constant musical sound in the background. And the frequent administration of chemotherapeutic drugs at doses below the MTD with no prolonged drug-free breaks is the concept of metronomic chemotherapy. Exactly like the metronome. And these days, we use the word metronomics because not only chemotherapy, within this concept or within this cocktail, we like to put in drugs, other chemotherapy drugs as well. So the word is now known as metronomics. So we basically give chemotherapy and or other drugs at frequent drug intervals below the MTD, and we prefer oral drugs which has very little side effects. So we used this anti-angiogenic metronomic regimen of thalidomide, celecoxib, cyclophosphamide, and etoposide, and in progressive cancers which had failed therapy after 2 lines of therapy. We were able to show that this regimen, which is costing less than 2,000 per month, is having a significant beneficial effect in non-bone sarcoma patients. This trial was published in JAMA by a group, and this very concept extended into other sarcoma regimens as well. So today, a metronomic maintenance regimen is a therapy that is administered in routine sarcoma regimens of rhabdomyosarcoma. We were not able to show that this very regimen works inhibitor as well in adult soft tissue sarcomas. So what are the lessons learned? All the existing challenges resulted in something better or equivalent than the so-called standard. I will now change focus and introduce to you another concept for research, drug repurposing. You all know that olanzapine is an antipsychotic drug. All of you know that? We used olanzapine as an antiemetic agent. This was the first trial that was done in children. It was published in JCO, which is a high-impact journal with impact factor 50 plus. And we were able to show that it has a significant impact in reducing chemotherapy-induced nausea and vomiting. Each drug has side effects. And can a side effect of the drug be useful? Shan Ganeshan used the side effect of a drug and converted it into a major utility for cancer care. One of the side effects of this drug, olanzapine, is obesity. We monitor weight when we give for antiemetic use. And Dr. Prashant Ganeshan, with his group, did this randomized trial in chemotherapy-related anorexia in locally advanced gastric, hepatopancreatic biliary, and lung cancer, and was able to show the beneficial effect of olanzapine's side effect into a beneficial role. I have also been very curious about the Indian system of medicine. It's just that it needs to be tested in a systematic way. Our group did test ginger as for antiemetic use, and we were able to show its utility, but it is yet to find mainstream acceptance. I will now switch gears and ask you a MCQ like you have in NEET. which is the most important quality that you people need to have to be a successful researcher. You have 4 choices, and in this MCQ, you can have all your choices correct, or you may have none, your choice. You have to be intelligent to be a successful researcher. You have to work very hard. You have to have novelty of ideas, but you think that the most important quality is not in this 4 choices. You can have any choice. My choice is that it is not listed here. So which projects get favored for funding? Multi-centric, collaborative, improving standards of care, and which are of national importance. Please focus on the first 2 statements, multi-centric and collaborative. And with this thought, I want to introduce this concept of joint family. Many of you probably stay in nuclear families. I, belonging to a smaller place, ended up going to Pondicherry and then Delhi and stayed in a nuclear family. And I always envied all those people who were staying with their parents and or in-laws. Because how useful it is to be in that concept. Obviously, when you are with your in-laws or parents, there will be some of them gets lost, but you also get the benefits. For research, if you have to be successful in research, you cannot be working in a nuclear family. I can tell you with certainty. If you have to succeed, you have to work in a joint family, you have to collaborate and accept others' viewpoints to rise. And this is one of our papers that we published in Lancet. We collaborated with 3 institutes, Adyar Cancer Institute, Rajiv Gandhi Private Cancer Institute in Delhi, and we were able to get data on more than 25,000 patients to get this concept of sex disparity in childhood cancer. The point that I want to explain here is concept of collaboration and forming joint families. Any of you after passing out may just join a smaller hospital or join a clinic. And my question to each one of you is that do you have to be in an academic center to succeed as a successful researcher? Many of you may think yes, but not necessary. And I want to introduce this person. This is Dr. Kawasaki. Dr. Kawasaki, after World War II, worked in a small hospital. And while working there as a physician, he noticed some patients coming with illness with red eyes, swollen lips. And he said, this is a new illness. And the people in the University of Tokyo mocked at him, said that, oh no, this is nothing. This is no such new disease. He published one of the best descriptive papers in the Journal of Immunology in the 60s, which till date is reported as one of the best descriptive articles on this disease. Yet people did not believe him. And it took another 15 years or so for this concept to come into the textbook of medicine in the year 1992, Kawasaki disease. He was able to prove the point as a discoverer of a new disease, which you know is a very common ailment for causing heart issues in children as well. Everybody wants to have grants to be a successful researcher. Yes, it's good to have money, but as well. I'm not saying you don't need money, but you can still succeed without money as well. We had a concept back in 2010, 2012, and we wanted to look at the difference in cancer. We didn't get the funding for that, and we still did the work. Rich, who had the money, we formed a joint family, and we published it 10 years later in still a very impactful journal. The message here is while you need funding, you can always look for other lab-based strategies or rich collaborators. Inventions, so Edison, many big scientists, Einstein, invented new things. Many of us are not that smart enough to come with new inventions, but we can always innovate. Like there was music made by Rahul Dev Burman in the past. And many of the musicians still innovate that music into a new concept. So we expect that the pharma companies will do that innovation for us. But the doctors working on the patients have to innovate. So back in 1990s in Bangladesh, a lot of women were dying of postpartum hemorrhage, and Dr. Saiba obviously could not purchase the very expensive balloons for the women there, which was costing around 600 to 700 US dollars that time. So she basically used a condom catheter hooked to a catheter, a condom to a service catheter, which also came to be used as a major measure to control postpartum hemorrhage. This was actually advocated across many low-middle income countries. My last MCQ for you. Which is after having talked about so many things now, which is the most important quality now required to be a researcher? Intelligence, hard work, novelty of ideas, collaboration of joint families, big brands listed here. Again, you have any of your choices, and your choices may be different for each one of you. But my choices, it is still not listed here in these choices if you have to be a successful researcher. And I'll tell you why I say this. I will read this letter for you. This letter was written to an Australian gastroenterologist, again in the year 1980s. Dear Dr. Marshall, I regret that your research paper was not accepted for presentation in the Australian Society of Gastroenterology. The number of abstracts that we received continued to increase, and for this meeting, 67 were submitted and only 56 could be accepted. So Dr. Marshall's abstract was amongst those 11 which was not accepted for a poster or a presentation. It was a rejected abstract. That for this very rejected abstract, Dr. Barry Marshall won the Nobel Prize for saying that helicobacter pylori is the cause of peptic ulcer disease. At that time, the pharma industry never wanted that an organism should be up as a causative organism for peptic ulcer disease. At that time, cimetidine was being used, and it was used for lifelong. You wanted to discover an organism and you treat it only 2 weeks of treatment and the entire disease would get cured. He won the prize for this rejected abstract. The point that I wanted to make was that it is important to get failures if you have to succeed as a researcher. If you succeed in your first time in your PhD project, I will say that the future is bleak. You are not going to be a successful researcher. You have to fail if you have to be a successful researcher, because only your failures will tell you how to succeed. So overall, the lessons that we have learned are you have to collaborate, form joint families, even if in your research, even if you are staying in a nuclear family. Lack of funding does not mean that you cannot do innovative research. And you should accept failures easily. Don't despair and go forward. That's why it is called as research. You have to keep searching again and again. I want to thank my team, which helps me to do my research. I want to acknowledge my teachers, my residents, my PhD students, my colleagues, my collaborators, my family, funding agencies, and several NGOs which fund me and my research, pharma industry as well. I want to thank JIPMER Pondicherry, where I was initially taught and learned the basic medical skills. I want to thank All India Institute of Medical Sciences, where I did my residency and continue to practice. And above all, I want to thank India, which gives us this opportunity to learn so much with such bright names. Thank you very much.
Thank you so much, sir, for the enlightening discussion. With your permission, sir, I'd like to open the floor to questions. We have a few questions from the audience seated here, as well as some that viewers of the live stream have sent in. Anyone with questions, please raise your hands. Yes, sir.
So, I'm Nilha. How much of statistical knowledge do we actually need for research? Because I think we have to struggle on that part, and how do we improve on that?
So your question is that how much statistical knowledge is needed for research? I would say that any research, as a member of the ethics committee, I will say that any research done without statistics is partially unethical, because if you subject any subjects to an intervention which is not going to yield anything, then why even do that research? You need statistics, understand, and from your interventions. Hence, I would strongly advise that all of you should get the basic knowledge of statistics. And obviously, over time, when you do your work, that knowledge will get expanded.
Thank you, sir.
Good morning, sir. My name is Dhruv Avasti. Sir, we have heard that getting a research published in high impact journals is very tough. So, what are some practical steps that we students can take so that we can improve our chances of getting our research published in high impact journals?
So, the most important thing is look at high impact journal publications are how novel is the idea. Many times I find researchers in India saying that, oh, this work was done in the US, so let's try it out in India. That is not an innovative research. You may publication, but if you want a publication, then the idea has to be novel. That's the first part. The second thing is, the girl had asked me about statistics. The research methodology has to be very robust. And one of the components of the research methodology is statistics, besides many others. These are the 2 points that I would say are important for getting high impact publication: novelty of idea and good methodology. The results are not critical.
Thank you, sir.
Morning, sir. This is Suhit. So if a research project takes too long or it goes other way, like we didn't expect it, When should we decide to abandon it or maybe modify it?
So research isn't 1 year or 2 years. That's the first lesson I want to share with you. It takes 5 years. I first did a project in 2004 from the Department of Biotechnology, published in an impact factor 30 in 2014. Years. Because if you do an intervention study, take 3 to 4 years to recruit, and if you want follow-up, you may need another 3 years. So if you want to do it fast, you have to collaborate, join families, get the work done faster. The question, can you abandon it in between? In real situations, can. Some research was abandoned during COVID. In fact, our last trial that we have just concluded got stretched for a period of 6 years for recruitment because of the COVID pandemic, because for 2.5 years, our barely 10 to 20% of what we were expecting. If you abandon the research in between, the value would go down. I understand that in exceptional circumstances, you may have to do it, but you have to accept the value would go down. There's another way how you can start in between. Designs. In adaptive trial designs, what happens is the outcomes, some other outcomes. Stop and then we can continue. As you build the career of how research can be finished earlier in time.
Thank you, sir.
Sir, if multiple project ideas. If multiple project ideas are brought to you, what would be your criteria to approach, sir?
So the question is saying if multiple ideas are brought forward, how do you choose the project?
Yes, sir.
So forward, choose the 3 criteria in my choice. One is the variety of idea. That's number 1. Second is the feasibility of that idea. Sometimes the idea may be very novel, but it may not be feasible. And third is the available funding. But if the idea is novel and only funding is the missing link, then I would go in restrictive factor. Several people in this country, several researchers, infrastructure to get your work done. The feasibility has to be there. If it's not feasible, then no matter how good the idea is, then it will not work.
Morning, sir. I'm Shadan. I have one doubt. You are talking about collaborations. The thing is, I find community medicine faculty have been more cooperative when it comes to collaboration. So, what's your point on this? Like for collaboration, you can go with our batchmates and faculty, but I think faculty members from community medicine have been more supportive. Whom we should prefer? Like if other faculties are there in other streams also.
you collaborate with is very difficult to answer. The concept that I wanted to stress was that don't work in isolation. Build teams for research. And that building of team could be with faculty members, could be with your colleagues, could be with your juniors. And only then the advantage is your work gets distributed. You will get more ideas and you will be able to finish your work in a finite time. Just to answer one other point, everybody in a collaborative group also wants to get recognition, which is well accepted. And whenever you form groups, and I'm talking about multi-institutional groups, usually the person who develops the idea and the project and gets the funding ends up being the lead researcher of that team. And it's not necessary that the ones who contribute the most have to be the lead authors, because generating the idea and getting the protocol and getting the funds is a much bigger issue than just getting the subjects. Everything adds to the project. In some of our groups, we developed a concept that depending on the number of patients recruited from each institution, the number of authors would be given the due contribution in author listing, so that the numbers are also enhanced. Otherwise, some people may say, oh, I'll contribute 5 patients and the work is done. No. If you contribute more patients, the number of authors from your institution will also increase. So in a joint family, if all people have to work, only then the joint family succeeds. But you have to accept some of the whims and fancies of others. That acceptance you have to accept. I'm not sure if I've answered your question and if I understood your question well. I will only say that you can collaborate with whosoever you think can bring benefit to your ongoing research.
Thank you for the questions. We'll move on to one question that we've received from the viewers of the stream, which is, you've mentioned the importance of securing adequate funding. As young researchers who might have secured funding from private institutions, what challenges do you anticipate they might face in ensuring that the research remains unbiased?
Ensuring
that the research remains unbiased.
So getting funding from private institutions doesn't mean that your research will be biased. I don't think that implies. So if you get a drug from a drug company, you get manpower to do that drug. The clause is that you will analyze the data, answer the question, or you can give it to a third party. You will not like to give the analysis or the results. Funding agency get the answer made from the study. That will eliminate the bias. And that part is very clearly stated in the publications based on the funding from whom you have received.
So we have one question from one of our faculty members.
Yes.
Ma'am, absolutely, ma'am, please.
So thank you so much. I think the students are really inspired, and the discussion also went on very well. I just had one doubt about the olanzapine being anti-emetic, repurposing of drugs, what we were discussing. I could understand Prashant's idea of using it for anorexia. But how did you get the idea of using it for as an anti-emetic?
So there was some data in adult that it can be used. And even prior to that, there was data that it causes kind of sedation and removes the vomiting tendency. There was some anecdotal data prior to that. And that prompted us to do this.
Tried it in the pediatric population?
Yes, it was not tried in the pediatric population.
So it was the first one?
No, yes, it was the first trial. And that's why it got published in the Journal of Clinical Oncology. So again, Prashant's work, again, because the idea was novel, so it got published in journal. The idea has to be novel. That's the most important.
Thank you, sir. Thank you so much for the talk and the questions.
Thank you so much, sir. We have a few more questions, but in the interest of time, we'll have to close the floor. The organizing committee would like to present you with a shawl and a memento as a token of their appreciation. So if you could please stay on stage for a quick photograph with the OC. Once again, please put your hands together for Dr. Samir Bakshi. Before we move on to our next speaker, we'd like to play a short introductory video. Actually, presence of Dr. Madhu Shashidhar is another proud junior alumnus who has a sterling reputation as a physician administrator. This is the product of his decades of service as a renowned pulmonologist at the Cleveland Clinic and then as their chief medical officer. He then had stints heading Cleveland Clinic's facilities in Florida and Abu Dhabi, after which he's returned to India to take the reins of the Apollo group of institutions. His very rooted and relevant takes on today's medical landscape have been instrumental in redefining the scope of medical administration, as well as broadening therapeutic and professional horizons for career clinicians. Here to open our eyes to the opportunities as well as challenges that lie ahead of us, I'm happy to welcome Dr. Madhu Shashidhar.
Thank you so much for that introduction. I have to say that when I came into the campus yesterday, and I really want to thank the organizing committee, it's a very proud, it's a very emotional moment for me to be back. I'm literally returning after 30 years. And I do owe this institution a lot, professionally and personally. Uh, Too tall for them. Before I start, let me just mention something. Life is much clearer when you look at it in the rearview mirror, right? In the mirror, you do not realize what is happening to you. We were talking about the day, and one of the students asked me, we were asking him about Pondicherry, and he said the weather here is unpredictable. And it got me thinking because, as you heard in the introduction, one of my last roles was as president of a hospital system in Cleveland Clinic, Florida, where every year from June to about November, we would prepare for the hurricanes. And every time the hurricane came through, it would just take houses with it. So when you leave Pondicherry, you will realize that you had fantastic weather here, right? Let me just make two other observations. It's very clear to me now that you are all in the midst of the highest density of intellectual capacity that you have. It is some of the brightest minds that are your colleagues and your peers. I would want you to keep that in mind as you go through your MBBS journey. The second is that your faculty and mentors that you find here will be the most dedicated people, the people most dedicated to your career. And it is very unlikely that you will find such a highly dedicated group of people in your life. So, and I look back to my memories of JIPMER, and that is absolutely true. So when I was asked to map out my leadership journey, what I did was I just put it in a map. It's a reflection of things that have happened to me. It was never intentional. As I said, leadership looks clearer when you look at it in a rearview mirror. At each step of the journey, I will mention a couple of key takeaways, things that have happened to me, which have been leadership lessons for me. I started my schooling in Kerala. I was born in Trivandrum. I did a bunch of my schooling there, and attended Loyola School as a boarder. It was a boarding school, very tough school. Brought up in the Ignatian way, St. Ignatius of Loyola. What you see there are pictures of Loyola School. That's the entrance. It's a very old British design, Baker design building. Open face brick is a very, very beautiful campus, somewhat like the JIPMER campus. And I put that last picture in there because those were the steps where we would have our assembly. And almost every day in the assembly, the teachers would drill into us these incredibly valuable lessons, what they call Ignatian virtues. Be aware of yourself. Lead with ingenuity, display heroism, and always lead with love. And actually, some of them are the things that they did, right? Every day at recess, when we had to go out, the senior school boys had to take care of the children from the lower grades. We didn't think too much of it at that time. But these are the leadership values that you inculcate at an early age, and I think things that I've taken away, especially around leading with compassion and empathy, and having a mission, having a direction and purpose in life. Now, the one other interesting aspect of this Jesuit style of leadership, the way they taught their students, was there was a strong focus on sports. While it was not clear to me why they focused on sports, it's very clear that sports inculcates a sense of fairness. And I'll come back to the sense of fair play later. But through sports, the Jesuit fathers wanted to inculcate in us a sense of fairness, a sense of collaboration and cooperation, because nowhere else other than sports will you see cooperation. You see that as your teams are putting on activities like Spandan or this activity itself. It takes multiple teams to come together to cooperate. And the fundamental basis of cooperation is a sense of fairness. And this is a concept that I will come back to later. It also allows you to frame failure. Nothing better than failing on a football field or a basketball field, but still picking yourself up and going through life again. So these are incredibly important lessons, and a couple of things stand out, especially one particular story. I was in the boarding school. We were playing basketball. It was a very informal game. We would play it every day. So I took the ball from one end of the court all the way to the other end of the court and took a fancy shot. Of course, missed and didn't get a point. And one of the fathers who was there came and told me, "What were you trying to do? There was an entire team. You didn't pass the ball. You took it all the way there. That is not fair to the rest of your team. Why don't you try that 50 more times?" Not fun trying to drop a basket in 50 times, but that's a lesson that has stuck with me for life. It is about fairness, and fairness as a fundamental tenet of collaboration and cooperation. So at the end of high school, I did and plus two, I did what most kids do, which is wonder what to do with your life. I was always tinkering with electronics. I had a fondness for electronics at that time. This is before computers. And I was sure I was going into engineering college, but happened to write the entrance exam for JIPMER and got selected to JIPMER. I had no idea what a career in medicine meant. So accidentally, here I end up in medical school. And so I'm here in Pondicherry. And those are actually some pictures from JIPMER those days. I think you saw the first picture in Samir's presentation. That is actually one of our class pictures. Samir is there in the back row. I don't know if you can see him. That's Samir right there. I don't think my pointer is showing. And I'm also there in the back row. And JIPMER looked a little bit different, but I think the spirit among the students was the same. We had a lot of fun. That is some of us at Thinkers Park. I think I'm up there. So it was a lot of fun those days. I completed my MBBS here. I stayed on for a brief period as an anatomy demonstrator. And I was also president of the JSA, and we put on the Spandan activity. And again, through this activity of Spandan, getting all of these committees to work together, an early lesson for me was how do you harness discretionary effort? Each one of us can put in some discretionary effort, but what is the key? What is the key that leaders can use to motivate people and harness discretionary effort? And for those of you who are looking at a career in leadership in healthcare, the key to success is getting teams to collaborate and cooperate and motivating them for effective teamwork. And I think I want to congratulate the team that has put up this event. I think it's an example, an excellent example of good teamwork. Because whether it is fundraising or an activity like this, what stands out for the JIPMER students is how much you get done with so little, right? In terms of resources, you have so little, but you get a lot done. So congratulations to all of you. Now, there are second order effects. I was told last night by Lata that my wife may be dialing in, so a little bit of pressure, but my wife was also a batchmate. She was also here at JIPMER. She completed both her MBBS as well as her MD in anesthesiology. So that's a somewhat earlier picture of hers. It's a family picture on the left. Those are our two children. I never show family pictures, but I think this is appropriate because they are truly JIPMER babies. And this is what I mean by second and third order effects, right? Decisions that you take in life often have second and third order consequences. In this case, my children are second or third order consequences. You also see a little dog in the background there, photobombing the picture. They're both pretty much grown up. Our older one, Divya, is now heading to law school. She is in New York. And the boy, the younger one, is a freshman at Ohio State for computer science. My wife is right now in Cleveland, Ohio. If not, she would have loved to join. She is also a very proud JIPMERite and a batchmate of Samir and I. So at the end of MBBS, I had a little bit of a career question as to what I want to do. And I was very fascinated with critical care. Critical care for me was an opportunity to now meld my fascination for engineering with clinical care. Because critical care, at that time, it was a very nascent specialty. In India, there were not many programs of offering critical care as a subspecialty. But you've got to play with a lot of medical equipment, right? Ventilators, monitors, hook them up. And this fascinated me. I was really fascinated in the discipline of critical care. So I took my USMLE and went to the US, started my internal medicine residency 1994. The hospital that you see in the left is St. Luke's Hospital. It was established in 1858, Morningside Park in New York City. If any one of you have watched the Netflix show New Amsterdam, it's modeled a little bit around the hospitals of those days. And the picture to the right is Yale University. I finished my internal medicine residency and joined Yale as a fellow. Those days after internal medicine, you would do pulmonary and critical care as a combined fellowship. And during this time, I developed an acute interest in research. Just as Dr. Bakshi has talked about, research was fascinating. The US healthcare system is heavily weighted towards research as a career path. In fact, as a fellow, you're almost required to do original research. So as he said, it has to be a novel idea. It has to further the science and be publishable. My research was a little bit more on the basic science side of things and was very curious about mechanisms of disease. So don't see all of that up there on the image, but it was primarily around mechanisms of lung injury. I had animal models, including mice models and some cell culture models. We were very interested in an enzyme called hemoxygenase, which is protective in the lung, especially in hyperoxic or lipopolysaccharide-induced lung injury. So those days I was literally a lab rat. I used to work in our animal lab and come home, sometimes in the winter, wearing a sweater that smelled like hamsters and mice. But absolutely enjoyed it those days. Enjoyed the fact that I was creating new knowledge and researching into mechanisms of disease. And I would say it was a fairly successful career. But at some point towards the end of my research career, I decided to leave that. Although it was not very clear to me why I was leaving a career in research at that time. But I feel that one of the key factors that led me to switch away from research, and some of you had brought it up in the previous session with Dr. Samir Bakshi, was around funding. And especially when we look at funding for basic science research, there are very few sources. Most of them are publicly funded, those days through National Institute of Health or other sources. And I felt that the funding system was very opaque. As a very junior scientist, I had trouble understanding how research funds were allocated. And there was a sense of unfairness about it, right? And for a year or so, I wrestled with this. Why is funding so unfair? My ideas are good. Why cannot I get funding? And it comes back to this fundamental concept that I think I've been moving throughout this talk of fairness and why that is important in your careers as doctors, but also if you want to be leaders of people and organizations. In any case, at the end of this, I decided that a career in primary basic research was not for me. So I took the next step. I had a list of publications, so fairly, active publications at the beginning of my career. But I took a turn from it and joined this institution called Cleveland Clinic. Cleveland Clinic was established in 1921. It's a well-known US-based system that is now a global presence. By that time, I was a fully trained pulmonologist and intensivist. I was looking forward to a career in clinical medicine. Those days, interventional pulmonary medicine was just coming to the field, and I was very interested in interventional pulmonary medicine. I reframed myself as a lung cancer doctor and started to practice medicine and with a significant focus on education and research as well, some clinical research. And those were incredible years. What you see on the left is an image of the Cleveland Clinic original building. Today, Cleveland Clinic is in multiple sites, mostly in the US, a unit in Toronto. There is a Cleveland Clinic London, which is right next to the Buckingham Palace, beautiful site, and Cleveland Clinic in Abu Dhabi. I was fortunate enough to have served both some time in Cleveland Clinic, Ohio, about 15 years, sometime in Cleveland Clinic, Florida, and I in Cleveland Clinic, Abu Dhabi. I would say from a professional standpoint, this was an incredibly formative year for me. I grew professionally, but also started to take on more roles, both within the Cleveland Clinic and outside in administration and healthcare leadership. The Cleveland Clinic is very focused on leadership as a pathway for physicians. They have their internal academy. It's called the Samson Academy. It also accepts nominations from international candidates and puts them through a rigorous internal course to develop healthcare leaders who have a clinical background. So the professional side of the journey, starting in 2007, when I joined the Cleveland Clinic through to 2023, when I left the Cleveland Clinic and moved back to India to head up Apollo, I had various roles, right? And the key takeaway here is that your career in medicine is going to be non-linear, right? The best jobs in your life will come to you. The best jobs in life are not the ones that you go looking for, they are the ones that come to you. So these were opportunities that came to me. I was focused in interventional pulmonary. I became section head for respiratory care at an enterprise, meaning the entire Cleveland Clinic enterprise role. I brought together a lot of services across our regional hospital systems. And by the time I left the Cleveland Clinic in 2023, I was leading our hospital system in Florida. There are about 5 Cleveland Clinic hospitals in Florida, and hence the story about hurricanes, which were an annual feature at Cleveland Clinic in Florida. I think equally important for my career was what I did as non-professional activities. And so as you go out into the workforce and you start a career in medicine, primarily focused on clinical medicine, keep in mind that what you do in a non-professional setting may be equally important. I went through a lot of leadership training internally. I was selected and nominated into a leadership academy, which is a small group of doctors that meet every Friday, engage with senior leadership and ask difficult questions like how do you manage performance of a doctor? How do you manage a doctor who has skill issues? How do you manage substance abuse or mental health issues? So we worked through these issues at a very early stage in my career. Also, they sent me to training, hardcore training that I hated, looking at Excel spreadsheets about healthcare, finance, and accounting. And during this time, I also started to dabble in IT and then went on to get a computer science patent. We patented it, we commercialized it and sold it. It was a clinical decision support system that is still used in the industry today. So there was a lot of activity that while at that time it was not directly linked to what I was doing on the clinical side, there are opportunities that came my way, opportunities that I happily took on. But I will tell you in the rear view mirror where I am today, they make perfect sense and they're incredibly valuable to me. I also had a lot of executive coaching. And I'll come back to the value of coaching and mentorship. I had at least 3 executive coaches. It is a feature of the US healthcare system where if you take on a leadership role, you will be assigned a very experienced executive coach who is from outside the organization so that you can have the confidential conversations to help you in your leadership decisions. There was also an extensive similar arrangement between the Cleveland Clinic and the Wharton School of Business that I was involved with for 18 months. So I would say that whatever leadership training and education I have had is a sum total of all of these experiences. There are also incredible values and lessons that I learned there. They're very, very numerous to list, but I want to share 2 or 3 with you. On the left, you see the 4 doctors who in 1921, right after the war, created the Cleveland Clinic. And their idea was very simple. Let's create a new model of healthcare. Let's create a new model of healthcare that is not based on transactional fee for service, but is based on how much value you add to the patients. Everybody is on a fixed salary. Everybody gets an appointment letter for 1 year, and there is a rigorous annual performance review with your chairman. And this model, which the Mayo Clinic is also a very similar model, has endured for more than 100 years. The lesson here is that culture matters. You want to create a strong organization, you want to create a strong institution, create the right culture, and it will endure for 100 years or more. The picture on the right side, so these are the four doctors. The picture on the right side is from an event that occurred in 1929. So this is less than 10 years after the clinic was established. There was a fire that broke out. And the story of this fire is actually interesting. All films those days, they're on hard copy, right? Many of you haven't seen a radiograph. You're used to digital films, but we all grew up on X-ray films. X-ray films are coated with silver nitride, and silver nitride is a highly flammable explosive material. These X-rays were stored in a room which had a boiler pipe run through it. Keep in mind, Cleveland is in a very, very cold part of the country. So in the winter, this boiler pipe heated some of the films, and they got hot enough that they all burst into flames. The smoke spread out throughout the building. These are firemen, doctors, nurses who ran into the building, pulled out patients. Some of the doctors died, some patients died. Now, in many institutions, this would have been catastrophic. That would have been the end of the institution. And there were questions those days. The financial burden was high, and it was not believed that the Cleveland Clinic would build itself. Not only did it build itself, you saw some of the phenomenal buildings that you've seen, but it also used that crisis to reframe itself. And the lesson today is that the Cleveland Clinic leads in patient quality, safety, and outcomes. It leads the world in high reliability framework. It leads the world in high quality patient experience. And what that tells you is that you must never let a crisis go to waste. While in the moment you may be consumed by the crisis, these are opportunities for you to learn and reframe the way you work. And I will leave you with this letter. I pulled this up. This was from 2 CEOs back. Floyd Lee was a cardiothoracic surgeon who was also the CEO of Cleveland Clinic. But he wrote this letter. He would send out this newsletter every month. But I think there are 2 parts of that newsletter that I want to want you to focus on. This, and this is how you build culture in an organization. Patient experience is about acknowledgement, introduce yourself, provide the right information, explain, and show gratitude for the patient, right? And he goes on to say, and this is the words of Dr. William Lauer that he repeats, a patient is the most important person. The patient is not someone to argue with or to match wits with. A patient is not dependent on us, we're dependent on them. A patient is not an interruption of our work, it is the purpose of it. The patient is not outside our business, they are our business. And the patient is a person, not a statistic. So for those of you who are embarking on a career in medicine, I hope these words will resonate with you. They've certainly stood by me, and every opportunity that I've had since 2007 to speak to a group of professionals, I have quoted this or shown this in some format. So there was an opportunity that opened up. It was a difficult one. It was our Cleveland Clinic facility in Abu Dhabi. That is the building that you see on the left. It is an absolutely gorgeous building. It has more glass than the Burj Khalifa. It is lit in blue, and if you're anywhere in the Emirate of Abu Dhabi, you can see it from miles away. It is a tertiary care facility, but establishing an American-style facility in a foreign country is tough. And there was an opportunity to lead this as the chief medical officer. I was in Cleveland Clinic Abu Dhabi from 2018 to 2021. And again, it was a very, very challenging, very tough environment, but it was also an environment that I learned a lot. I put in some pictures. The picture in the middle are my management trainees. So we would get management trainees from across the world. Doctors, nurses, other professionals who wanted to get into healthcare leadership. We conducted a Middle East Health Leadership Program. We also forged a lot of agreements, and I have taken a couple. The one at the bottom I'm very, very proud of. And this was in 2018, late 2018, early 2019. It's a Kawayasmi Institute, which is a college in Abu Dhabi. Kawayasmi was an ancient mathematician. And I worked with them to bring respiratory care to Abu Dhabi. First respiratory care school in Abu Dhabi. Very proud that the first batch was all female, all Emirati, half of them sponsored by Cleveland Clinic, Abu Dhabi. It was a passion. We got it accredited by the American Association for Respiratory Care, not knowing that a year later, COVID would hit the Emirate, right? So sometimes when you do these things, you don't know, as I said, the second and third order effects. It is still a proud institution for Abu Dhabi and continues to have a high end of respiratory care professionals coming out, and still largely female Emirati, oftentimes the first people in their family to have higher education. So I pulled a few slides from my work at Cleveland Clinic Abu Dhabi. This was my full-time administrative work. People ask me, even my children would ask me, what does a healthcare administrator do? So this is just a few examples of the kind of things that you would do if you were a healthcare administrator. You're responsible for access. What does that mean? You're responsible for making sure that the right services are available to the patients that need them. And we'll spend a lot of time, and to me, my research days came in very handy because I was good with data, I could analyze them, so I would bucket them, perioperative access, outpatient access. Let's look at the data. We started using predictive analytics and things like time signature analysis to convert data into new knowledge and to derive value from it. These are the kind of things that a medical administrator does, but it also told me that in your path of leadership, some of the skills that you acquire early in life, you will never know how you will use it later in life. There are several other sort of buckets of activity. You spend a lot of time optimizing patient experience, clinic workflows, and I could go on and give you some more examples. Affordable care, an issue not just in this country, but across the planet. Even in the most wealthy nations of the planet, you are still looking at how do I make my care more affordable? How do I look at physician productivity and make my physicians more productive? How do I improve the quality of my documentation? Any part of the world that you work in, if you are a healthcare administrator, you have to make sure you optimize revenue. Sister Francis from the Sisters of Charity said 40 years back, and this is a not-for-profit system, no money, no mission. And it is true anywhere, even if you are in an academic institution like JIPMER. Sustainability is key to making sure, and of course, educating those who serve. So this was my time in Abu Dhabi. I thought this was a good time to enroll myself in an MBA and get a formal education. So I picked this institution that is based out of Fontainebleau. It's right 40 minutes from Paris. The institution is called INSEAD. It's a European business school, well known in European circles. I thought it would diversify my education a bit. You can see me right there in front of the Fontainebleau campus. If any of you decide to get an MBA, it is equal mixture of very, very, very hard work and a lot of partying. So you have to be prepared for that. And some of that is truly networking, learning how to influence people, learning how to interact with others. It was, in my mind, an important part of my career. I think an MBA helped me. It helped me to understand the fundamentals of business. It has helped me to conduct myself appropriately in a room full of professionals. And I think even again through my MBA, what is evident to me that you need effective coaching and mentorship throughout your life. It does not stop with medical school. It does not stop with your early part of your career. Mentorship and coaching are things that you will do, you will need, and will help you throughout your entire lifetime. Then, of course, something that we were never prepared for. Here, I was doing an MBA. They were trying to teach me how to lead organizations, how to manage disruptive change. At the same time, perhaps the biggest, most disruptive change that humanity has faced hit us. I was simultaneously running a hospital, trying to finish an MBA, and then managing COVID epidemic for that region. And so these are some pictures of me trying to get through that COVID. That tent was what we put up. I was also doing clinical work at that time. And at the end of it, what I saw was a lot of people working really, really hard, sometimes even putting their life at risk, right? I had Filipino nurses who had not traveled back home for a couple of years, taking care of critically ill patients when their own family members were in the ICU on a ventilator back home. And what was very clear to me that was that people will sacrifice, will work really, really hard if they have meaning and purpose. Meaning and purpose are incredibly important in what you do. And it is probably at this point in time, even more so important in healthcare than it has ever been, right? If you look at healthcare across the planet, I'll give you a US statistic. The year I left, 2021, a social media group called Doximity. It's like LinkedIn for doctors in the US. 80% of the US doctors are on Doximity. They conducted a poll and found that 72% of the US healthcare workforce, physicians, are burnt out. 72%, almost two-thirds. Of that, half of them are considering an option to leave the profession completely. You know, the work that you will do as a clinician is not easy. It is extremely rewarding, but it's not easy. So it is incredibly important that you find what gives you meaning, what gives you purpose to stay engaged and to avoid burnout. And this, nothing more than the COVID pandemic, which brought that into focus. This was me during the COVID epidemic. This is our first patient, my first shift, March 7th. It's not 2025, it's actually 2020. I have to correct the date. It was our first patient. We knew nothing about COVID. We only knew about MERS, which was very, very fatal. And I'm double masked because I did not know if, this was, I was making a fatal decision or not. But we were all here, so I think it turned out well. So to wind up, I'll probably leave you with my leadership lessons, right? What have I learned from this? And I've learned that leadership is about 5 things, right? What choices do you make? What is your style of leadership? What values do you have? And above all, I focus on fairness. I think throughout this talk, I've stressed the importance of fairness, and I'll share with you why that is important, and leave you perhaps with a few principles. So why would you choose leadership? It's not easy. It's a 24/7 job. It doesn't stop. You do not get to pick when a fire happens in a patient care area. You do not get to pick when an employee has an unfortunate event. Your employees will depend on you. They will call you. You have to be there for them. It is not about life and work balance. It is about life and work integration. It is incredibly rewarding. I will do it again. But you do need empathy in those difficult moments. You have to continuously learn. Every CEO is learning about AI now. They are going to course us to see what is data, what is AI. I'm learning about construction in the Indian hospital industry. So you have to commit yourself to a life of learning, and you have to be incredibly, incredibly resilient. Style. So early in my MBA, people would ask me, what is your style of leadership? So I read a lot of books, right? And these are some of the books that I read. Please don't read them, because at the end of it, I was more confused than when I started, right? Every few days, there is another style of leadership book that pops out. And one of them is actually by one of my professors, Charlie Delaney's book on backstage leadership. I still haven't figured it out. So after reading all of these books, right, I was left very much like this poor lady out there figuring out what is this all about. And the conclusion that I've come to is that leadership is not about style, right? Leadership is really, in my opinion, about values, right? You really have to lead with your core values, because when you wake up every day, the challenge in leadership is you have a lot of options and inputs, and you have to quickly assess them. You have to make the right decisions. You have to have the courage to see that through execution. But above all, you should construct this on a solid base of values that are important to you. And to me, there are 2 values that are incredibly important. One is this idea of reciprocity, which is fairness, and the idea of empathy, which comes out of compassion. And of these, I think fairness is an incredibly important value that I can understand. It is biologically rooted. And I'll give you some reasons why fairness as a concept is incredibly important. I'll share some videos with you, and hopefully this will come through. I've copied some of the work that was done by Meredith Crawford. So the one on the left is a video from 1937. And one on the right is a more recent video from Sarah Brosnan's work, right? How many of you do group study? Who does group study? Or did group study fall out of the way after social media? It's like 3 hands. Nobody does group study anymore. And Dr. Lata, of course, still does group study. No, we used to do group study. And how many people do the library and study as a group? Some people do. So this is the idea of cooperation, right? Dr. Samir Bakshi talked about it. He talked about it as the extended family concept, that collaborative and cooperative groups are far better than individual effort. So let me tell you, so you're going to see 2 monkeys and they have to pull a rope to get food towards them. And these are one chimpanzee monkeys, and quickly they find out it's better to play together. Dr. Samir Bakshi said this, collaborative effort is better. And they're actually teaching each other. You can see the guys saying, play. And then the other guys go, yeah, have to play, right? But over time, they get better at collaborative effort. And then you're going to see what happens when somebody is a little bit disengaged, right? And this happens in the entire animal planet. This experiment has been done with rodents, it has been done with dogs. Cooperation is incredibly important to animal species that have to work together. So you see this other animal in your group studies, a guy who's on Instagram, you have to tell him, no, come study with us, right? You have to get him back, refocus him. This is what happens during spunding when somebody is off, not doing their work. This happens across the animal planet. So a fundamental concept of leadership is what I said, harnessing discretionary effort. And you can see this chimpanzee harnessing discretionary effort, right? Of getting people to cooperate, communicating effectively, and pulling together, as Dr. Samir Bakshi said, as an extended family, not entirely through individual action. This is a fundamental quality of good leaders, is that they can harness team effort. But it's not just about team effort, as I will show you, because what ends up happening is that the world is not fair. And there is an expectation of leaders that you will lead with fairness. Fairness is deeply rooted in biology. It is wired into us. It has been wired into us over a few million years. So Sarah Brosnan did this work, and this is from a TED talk. I don't know if the audio will come through. If not, I will talk over. And this is about capuchin monkeys. And these monkeys are getting paid. One gets paid with cucumber, the other gets paid in grape. Grape is better than cucumber. Now, if you give them just cucumbers, which is the lower half, they're happy there. They work for days. But if you give one of them a cucumber and the other one a grape, you're actually creating inequity. And in the animal planet, we are all wired to reject inequity, right? And you will see that for those of you who have children, the first thing that they'll complain about is that's not fair. So fairness is a fundamental construct. And I'll let him get through his quick description. I'm sorry that the audio doesn't. This is Franz Duval. Dr. Franz Duval was Sarah Brosnan's collaborator in the social experiments. And this has been repeated many times. So you'll see this video of this capuchin monkey. There are 2 monkeys on both sides. You have to do a task. They have to give a rock to the researcher who's standing here. So you'll see this monkey will give the researcher a rock. And then in return, the monkey will get an item of food, right? So he gives her a rock and he gets a cucumber. Happy, eats it, no problems, right? Now the other one gets a rock, gives a rock, does a task, but instead of a cucumber, he gets a grape, and this monkey sees that he's getting a grape. Now that's a problem. So now you see what happens. Does the task, gets a cucumber, and it does what any rational person would do. We will not accept inequity, right? And this has been a powerful leadership lesson that has stuck with me. And it's not just a leadership lesson. I'll tell you that when you're rounding on your patients, when you are leading a multidisciplinary team of nurses and physical therapists, when you're doing that effective teamwork, you have to ask yourself the question, am I inducing unfairness? It is not just about being fair, but it's also about effectively communicating fairness. And in fact, the business school that I went to has an entire paper on fair play leadership, right? That fairness as a foundational attribute of good leadership. So it brings me to the final point. I'll leave you with five. I like things in five. I can keep it in one hand. First, understand yourself. And if you think you've understood yourselves, every 5 years you'll say, I have no idea who I was. Second, as I said, find meaning and purpose in what you do. Incredibly important in healthcare. It will keep you grounded in what you do. Third, embrace opportunities. When opportunities came my way, I did not overthink. I did not know what does this mean for me in the future. But my research did lead me to being a better administrator. I understood statistics better. Third, fourth, seek out mentors. Good mentors are hard to find. Good advice is incredibly hard to find. You'll find some here, you have to find them throughout your life. When you find good mentors, keep them close. I told you about second and third order consequences. I even showed you pictures of my own second and third order consequences. And the last is take a broad and a long view of life. A broad view is when you have a life event and you say, what does this mean for me? What can I learn from it? That's a broad view. A long view is looking into the future and saying, how does this affect my life? What can I take from it? And how will it change my life for the future? Thank you all. It's been wonderful. What a privilege to come back in my memory.
Thank you so much, sir, for taking us along on that walk down memory lane. It was quite an insightful talk. Once again, we'll open the floor to questions, both from the audience seated here and some that have been sent in by those who weren't able to physically be here today.
There you go.
So you are you told that looking right from a rear mirror is. So I would like to ask you one thing. If you are allowed to tell one thing, the same like yourself was about to leave JIPMER, what would you say? First one.
Oh, you put me in a tough spot. No, I would say that, and actually, Bharat, right? Bharat. But, I was thinking this on my way in from Chennai to Pondicherry yesterday. I really think in some ways I took JIPMER for granted, right? And if I look at the profound effect that it has had on my life since I left, the connections that I had, the connections that I come back to, even as I speak to people like Dr. Lata, I don't think I had a full appreciation at the time for the profound effect that it would have on me. The fact that I was surrounded by incredibly smart people, every one of them topped their state and was just really a little bit quirky sometimes, but very, very smart people like Dr. Samir Bakshi. I think I didn't have an appreciation for that at the time, but I do know that since then.
Sir, I see that sir, share your experience in hospital management. You face some critical situation, sir. Share some points. Experience.
No. I mean, one, I was a critical care doctor, right? And then second, even on the administrative side, when you're overseeing the construction of a hospital, expect that there will be a construction accident and lives will be lost, right? You also have to sometimes take very, very difficult decisions where somebody has to be let go because it's a financial decision, right? And you're impacting the lives of people and families that depend on them. And it is very hard to purely make decisions on ethical and emotional grounds alone. And that's very hard. And I would say it is no different than withdrawing care on a young patient who has substantial, and I'll say brain injury, right? It's a decision that you have to make. It is not a decision you can take lightly. It will not sit easily with you. But at all times, you have to lead with what your values are, right? And that's why I say ground your decisions, your actions, and the way you lead your life on what are important values to you and what is non-negotiable. Did I answer the question? Or do you want examples? Examples are tough, but I hope that answers your question.
What do you think about in the future in medicine, sir? Whether the people will accept data collection by AI future?
So, let me just answer it this way. From where I sit, it's not a question of will AI have a significant role in medicine? Because today it is already having a substantial role in medicine. You may just not know it, right? A lot of stroke protocols are being done today in the hospitals that are run through AI, right? Early detection of stroke uses AI algorithms. A lot of polyp detection in colonoscopies is driven by AI and AI-based image analysis. So while today the vast majority of the use case is in image recognition, computer vision, that will change and it'll get into more of the cognitive side of things. It will fundamentally change how we provide care. I think in the public health talk, you heard about how do we screen for tuberculosis. We can now screen for tuberculosis using AI. The question is, how will we incorporate this and how will we teach? Because if a retinal scan can detect Alzheimer's or even pancreatic disease years before it happens, how do I teach undergraduates to incorporate that into your clinical practice? I don't have the answer, but it will impact, it will change, fundamentally change how we practice medicine. And it will happen in your lifetime very quickly.
Yes. Thank you, sir.
You're welcome. Who knew the question all the way back there? The young lady to the right.
My question: do doctors without MBA stand a chance in hospital admin, or is it essential management right?
If I can repeat the question, I think the question was, do physicians do a better job in hospital administration, and is a formal degree in business management required? Is that the question?
Doctors without MBA stand a chance in hospital admin.
Without an MBA, of course. Look, I don't want to give the impression that you should all out of the gate do an MBA. I did my MBA. I was one of the oldest guys in the class. I was in my late 40s. And I think it was better that I did my MBA then, because as I was going through my business school, every item that was discussed had some relevance. I'd lived through it. It was not abstract. So there is an advantage to an MBA, but I don't think it is necessary. And doctors, because of what you do, you're natural leaders. You lead decision making. You're effective communicators. You know how to lead a group of nurses and physical therapists. You get operations because you're managing beds and moving patients in and out. So even just because of the way you are trained as a doctor, you already have a lot of the skill sets to make yourself a very effective doctor. I would say within the Apollo hospital system, of the doctors who are administrators, about half don't have an MBA. In fact, we do send some of them to business school courses. So not necessary, and you will make a very good leader if you're inclined to with just your medical training.
Thank you.
Yes. The mic is not working. Why don't we do this? Can I give you this mic and I'll take the question from here? Is that okay? I'll give you 2 mics.
Morning, sir. I'm Sriram, a final year student from Chennai. I have this question for a long time, and I think you are the right person to answer this question. You are an idol. I see you. I see myself in your position in the future. So I suppose you are the right person to answer this question, sir. What I'm about? It is a series of questions, sir. So you've been a clinician, and now you are an administrator. How your clinical knowledge impact on being an healthcare administrator, sir? And as an young medical student like me, with both career options ahead, what would you choose as a career option, sir? Doing an MBA or doing clinic, getting into an MD course, something like that, or getting into research stuff, something like that?
So let me take the first question. It's incredibly important that I'm a clinician, right? And just recently, I was in a case discussion that involved a critically ill patient who came in with a septic hip, had a bad outcome. I think you get tremendous buy-in. Empathy that I talked about means that you can stand in the shoes of people who are trying to explain why in the middle of the night there was no bed and it was, right? You've lived those. So I think it has been incredibly helpful. And many health systems like Mayo and Cleveland Clinic require that only clinicians be in leadership positions. Should we do an MBA or not? I don't know. It all depends upon your personality. I've seen both career paths work out well. There is no correct answer. Both will work. It will depend on you to make it work, right? Either career path is right. You will have to work hard at either one to get to where you want to.
Sir. So for the position that you are right now, what do you think has impacted more, sir? Your clinical path or your role as an administrator? What would have influenced, like what had a great impact in giving you such a great high position?
I think both are equal. It's very, very hard to separate out the two. And I think they also have lent them. It's a very good question. I've always felt that my experience as an administrator made me a better doctor. I was able to understand effective communication, lead people better. And my experience as a doctor made me a tremendously much better administrator. So I don't necessarily separate the two. And I don't think one was a better experience than the other.
As a career path, what you see should a person as a medical undergraduate should pursue first? An MBA or a postgraduate medical degree?
Tough question. But I think these days it is very, very hard to have a meaningful impact unless you have a postgraduate degree, right? I think to have a body of work that you can point to and to be an expert at post-graduation, I think is almost necessary. But again, it's a very broad answer, and I think it'll depend on the career path you choose. I enjoyed my post-graduation and still read journals on pulmonary and critical care medicine.
Thank you, sir. Thank you.
Thank you. I think there was this young lady here has had her hand up for a long time in white. Can somebody give her a mic? And I'm mindful of time, so Anurag, tell me when we need to wind up.
Thank you, sir. I'm Meenu, sir, from Kaktiya Medical College. And my question is, as we have focused so much on fair play, I just wanted to ask you how you have dealt with unfairness as you've walked through this path on leadership.
I have personally dealt with unfairness to me or unfairness that I demonstrate to others?
No, sir. Unfairness that has been dealt by you.
Yeah, felt by me.
Yeah.
So I think in my early career, I had only one response, and it's very clear to me what my response was. I would pick up the ball and leave the court, right? And I did that on the basketball court, but I also did it in my career when I picked up the ball and left when I was faced with unfairness in research. I did not stay with the problem longer. right? I did not have the tenacity and the patience to stay with the problem longer. And somebody asked Dr. Bakshi the question, when should I wind down research? And his answer was, you have to stay with the problem longer. So I think the way I would deal with it is to be more patient, more persistent, and to engage with people a little bit more. And it's easier when you understand the problem for what it is, right? That it is inherently unfair and you understand what the drivers are. But kicking the ball and leaving the court is not a good.
Thank you, sir.
This point, I'd just like to mention, sir, that this is one of the largest crowds we've ever had for Inaugural for Connaissance. So I wanted to thank all the delegates for being there and for obviously moderating the session. In the interest of time, we'll have to keep it to one question per person. So please try to refrain from having follow-ups. Anyone else who has questions?
Good afternoon, sir. Mrinalini from Coimbatore. So my question is, you mentioned how it's important to have a purpose and meaning in what we do, which motivates us to do something further. Could you share what was your purpose and meaning which motivated you to do?
Yeah. So it took me a little bit of time to understand that personally for me. I think it came down to impact and understanding how best can I make impact and how can I be convinced that I'm making the best impact that I can make, right? And that eased the transition from being a clinician to an administrator and giving up some of my clinical activities. I spent a lot of time training myself to do things like endobronchial ultrasound and navigational bronchoscopy, but you are forced to make choices and you have to give that up. And today I don't practice clinical medicine, but I'm perfectly at peace with it because I measure that through meaning and what gives me purpose. And that allows me to work tremendously harder. I mean, way harder than people will tell you when I was in medical school, because I don't measure the output in terms of the input here.
Thank you, sir.
Is that it?
Sir, you have worked across the globe. How did you deal with the differences people, mentalities of people had? I'm Sankeet, sir, from.
Yes, tell me.
How did you deal with the differences in people's mindset and the changes, including the patient's mindset, when you shifted from the United States to Abu Dhabi and then Abu Dhabi and one more if you could answer. How do you manage doctors who are also seeing through burnout, but then you have to deal with them as friends?
Yeah, oh, it's a good question. His question was, how did you deal with differences in people? I'll give you a story, and I've repeated this before. I once had a very, very unhappy patient, MRD patient, and what happened was his doctor was German, and the family was supposed to come in and speak to the German, to this doctor, this German doctor. They were a little bit late, so the doctor told the nurse, who was Filipino, I'm heading out to lunch, so please call me when the family gets here. And he went to lunch. Now, culturally, these are very, very different cultures. Filipino nurses would never interrupt a doctor when he is out on lunch. German doctors expect very clear, concise, conversation. They're very direct people. And the Emirati culture can get very, very insulted by actions such as not coming up when you told them you would come in. And so I had this incredibly unhappy patient, whereas nobody had intended to be, impolite or do things in the wrong. Everybody was doing what they thought was right. So I think while diversity is great, you have to understand that diverse people may have different cultural contexts in which they operate, how they use language, how they communicate, how their expectations of timeliness. I think and this was probably the biggest advantage of my business school. It was an international business degree. They gave me a strong foundation and a framework by which I could understand these differences. And just like, classifying, painless progressive loss of vision or whatever you do in ophthalmology, it gives you a framework, it gives you an understanding and a way to approach it.
Sir, given your extensive leadership experience across different environments, and you have led people from different background and cultures, what do you think Indians can learn from people from like such backgrounds, and like what we can incorporate into our daily practices, like we lack or we can be better?
I think I think you had a fantastic example just before I spoke of Dr. Bakshi. I mean, look at the impact that he is making in his life, and he was able to do that because he was able to stretch. I mean, his career is a fantastic example. He went to the US, found an opportunity to expand and come back and expand and his impact on transplant is incredible. Wherever I travel, people ask me, "Do you know Dr. Bakshi?" So I think operating outside of your comfort zone and always being able to stretch yourself, I think is critical. It was not easy. I mean, moving to Abu Dhabi was not easy. Moving back to India has been difficult. But I think that is where the biggest opportunity is. I would reiterate and tell you what Steve Jobs said, stay hungry.
Thank you, sir.
So it's been a privilege. I really enjoyed it. I'll hang around for a bit along with Dr. Bakshi, but thank you all.
One thing, all of you, I'm Santosh Sadish, I'm professor of cardiology, and I am 3 years Dr. Madhus and Dr. very well. So one or two things, organizers, please tell all the people who are speaking, say your name and say which medical college you are from, and then you speak the question. That is one thing. And over Dr. Madhu and what you just saw, I've seen a lot of talks, I've seen a lot of lectures like this, as well as academic lectures. So this was a master class in how to prepare PowerPoint presentation. Okay, that's a big understand. You do not realize it now, but when you go forward, you'll realize what the particular PowerPoint presentation that Madhu could you just use some with special AI tool or something to make it, or?
No, it's a tool called Puzzle, but you know what I've learned is that humans are wired for storytelling. There's a reason why Ramayana is the best story that we never told for mankind. I try to make it a story and a timeline.
Thank you. Actually, this is one thing that all of you should learn. If you ask me, there are a lot of things that Dr. Madhu has told, including leadership, the way he has built his career. He has moved from the medical school to 3 different continents, actually, 2 different areas, and then he has actually currently he has come back to India. I'm like closing the full loop and coming in the circle. Ultimately, all these things actually make a lot of sense to you later in life. So what is important is whenever you, so this is, I would say, better than many other best steps that I have seen, it's highly inspiring. Let's take all these things to heart because it's that it's very important. What Steve Jobs said, stay hungry. So, Bruno was asking me, how do you jump from one part of one part of the medical career to the next part? Ultimately, each one of you, please understand, each one of you is unique. Each one of you have some particular skills. Just because you may not be the person who got the largest number of degrees in your class, you did not get distinctions, or you did not make it in first attempt, but you had some with failures during MBBS or post-graduation or anything, that doesn't mean anything. Okay. So this is an extremely inspiring talk. Thank you, Dr. Madhu. So,
Santosh, and before Dr. Lata speaks, I'm going to embarrass her. I'll tell you that throughout my career, I've dealt with, I've seen a lot of people who've been mentors who I still reach out to. You will never find people outside of JIPMER who will commit themselves to your well-being and your career like the mentors in JIPMER. And I've watched Lata now since I was and the kind of dedication and as a student advisor, the time and effort and energy that she puts in, make sure that is recognized, please, because I tell you, increasingly diminishing quantity and very, very hard to find, and should be treated with the respect it deserves. Lata, over to you.
Thank you, Madhu. But I think it's all the team effort of all the faculty and also with the students. Very happy. What I wanted to just tell about Madhu and Samir was it was just a coincidence that both of them belong to the same batch. Madhu was telling, we just thought of a first bencher and last bencher. I mean, when Santosh was saying, it's not about medals or not, it's all about how you want to go in life and what you really want to choose. Don't get confused. Think for yourself and then think whether you really want it. Don't do anything out of force. What I would like to say. Thank you. It's Anand and Madam and the colleague very good is also here. Thank you once again.
Thank you so much, sir. We'd like to present you with a token of our appreciation for your presence here today. I'd like to call Dr. Lata onto the dais to present Dr. Madhu with a token of our appreciation. Mamsitas, if you could just stay for a photo.
Huh? Okay.
What the part of the transfer of this kind of thing? Dr. Sabri. And the role we like to extend our so relevant to Dr. Kamal Chaturvedi. He is at the forefront of the radical innovation that has been plagued by its persistence as both a social and a biological poison. His Issues in public life and national policy are unmatched. They're also rivaled by his reputation as one of India's best heavenly surgeons. He's president faculty of multiple institutions and he's the proud author of over 50 papers in some of the most widely read journals in the world. His life's work has been all about fighting oral cancer on both fronts, providing preventive public health education as well as improving access to cutting-edge treatment. Interventions are a small testimony to his unwavering dedication and steel-like resolve to finding a solution to tobacco. It's honored to be able to welcome him as he joins us via a recorded video address.
Center for Treatment Research and Education in Cancer. Next 30 to 35 minutes, I'm going to speak on a journey in cancer care and control in India and lessons for the budding doctors. Let me start with the and that beginning was a very humble beginning in a rural area where my parents, my father was not so rich in terms of finances, but very rich in terms of moral values. With that, I demonstrate to you my birthplace, where I lived during my primary education and my school, which I'm very proud of, the Kendra Vidyalaya. Why I'm showing this? Because whenever I do any research, whenever I do any clinical work, or part of any treatment guidelines, I know it came from, and 80 to 90% of Indian leaders. So whatever I do has to be applicable to that population from where I came from, and that gives me strength in designing my entire clinical trials or research protocols. I was an undergraduate. I realized that I was not the smartest. I had an average IQ. And due to that, I was very, very confused that whether I would be a successful doctor or not. And then there was a chance that I went to SNH, SOS village in Varanasi during my internship. And trust me, that was my defining moment in life. I was supposed to go as my PSM rural posting for 1 month. I spent 3 months there, managed months and visits in that orphanage. And then I realized that sometimes we meet our destiny on the road that we want to avoid. And where I working with the children, I realized that I am a part of the best profession in the world where we can save life.
This is just a one everybody that at 1:50, Chaturvedi will be joining us via a video conference to answer any questions that the audience might have once the recorded video lecture is completed. Please do not leave the auditorium.
That's happiness. So, you want in class, I went the best undergraduate in the best job award in that particular job. When I was doing the post-graduation, as I told you, I didn't have a good IQ. I was not the most intelligent. I was not even most talented. But I realized that I was a very, very hardworking person. And in 1993, when the earthquake struck, then I realized that I'm also very impulsive and stubborn. And that is why I decided to leave my residency program and rush to the earthquake station. Without telling my parents, without telling my teachers, they were very upset that I suddenly disappeared and went to the earthquake area. The reason why I went there because I know that nobody will ever be my visit to the earthquake area, which was my calling at that point. When I went, I realized for the first time in my life, again, I was out in my life, people's person. I wanted to work with people. And trust me, the amount of experience that I got working in the earthquake area, disaster area, was something that changed my life forever. And when I came back, when I narrated the whole work that I did, my professors, my teachers, they were very happy. My parents were very happy. And I got the best postgraduate award for that particular year. What I'm trying to say that if your intentions are good, and even if you do certain activities like that, people do support you. After finishing my post-graduation, I was on the crossroads because I wanted to do either cardiothoracic surgery or neurosurgery. And there was an option of going abroad, but being a fiercely patriotic person coming from a family where my grandparents did get that moral value in me that you have to serve the nation, going abroad, though there was a very good option, but I never chose that option. And finally, I chose to be in surgical oncology. After surgical oncology, I decided that I want to do a head and neck cancer surgery, which is the commonest cancer in India. And I was fortunate that I did my residency, and finally I became the faculty in head and neck unit of our medical center, which has very high volume and high standards. And if you see the numbers that I'm talking about, this may not mean to young doctors or many people, but for a head and neck community, this is a very, very good volume and a very, very good statistics. And I'm proud to be part of this department. While working in the department, I realized that oral cancer is like an epidemic. It is so common, and it is a source of great distress and disaster in our community. And that is why we realized that there has to be something done by the Memorial Center in improving the current situation that we have in the country. Now, there was a publication that if you look at the publication, it very clearly says that the burden is rising, and this rising burden is despite so much of research that is going, so much of conferences that are going, so much of meetings that are going, so much of treatment care hospitals that are coming up in different parts of India. Therefore, something else has to be done. And I'm showing you the pictures of some of the patients that we see who are diagnosed with very advanced cancer. So much is the load that I started operating on the world's first cancer hospital on the train. That means I was doing surgery with anesthetists, post-operative care in rural area, remote area, tribal area, in a full-fledged operation theater that we had created in a hospital. So that I told you that I have to do something differently. And what is that difference? That difference is primary prevention. Treating patients, doing surgery, doing chemotherapy, doing radiotherapy, and radiology and pathology is not going to take us anywhere. Because for ovarian cancer, we know that these are the risk factors. And if you look at the risk factors, tobacco is number one. And I urge everyone to go against tobacco. The second is alcohol. This information is there about alcohol, that wine is safe, there is a moderate level of alcohol in which it is safe. When beer is safe, let me tell you, alcohol is a good one carcinogen. No form or no dosage of alcohol is safe if you want to eliminate the risk. If you want to reduce the risk, certainly there is a safe limit. But the choice is yours, whether you want to eliminate the risk of cancer or you want to reduce the risk of cancer. Similarly, oral hygiene is something which is very simple, and if it is promoted, it will have a dramatic impact. I'm not sure about Avika. Sure. Avika again is a group 1 carcinogen. Apart from that, we have something called the genotype, the marijuana, which is including the fruits and vegetables, and family history and certain phytonutrients. So these are the risk factors. Some are lifestyle related, and sometimes some of them are something that the messages in terms of sensitivity or some genetic disorder. So these are the ways where primary prevention can make a difference in the oral cancer burden in India. Talking about which predominantly people are using in smokeless tobacco form.
And smokeless tobacco, along with areca, makes a double whammy of carcinogen, which can promote ovarian cancer and can create a disaster for the population. And if you look at the burden of disease caused by tobacco, it is the number one cause of the non-communicable disease. It is the number one cause of the in the current human population. And here I would say that we must understand that the tobacco industry targets children, and we all have to work on preventing the non-initiation children picking up the tobacco, because once they are addicted to tobacco, there is no way you can make people quit tobacco. You can understand that these days, most of the cricket matches, the film festival, the food festivals, even cinema halls, if you go, television, these TIG ads or nutritional ads are coming. Those are the celebrated advertisement of tobacco, smokeless tobacco. Therefore, you can imagine how much money this industry has. That they have brought to most of the Bollywood celebrities, most of the Bollywood actors. James Bond is advertising for pan masala, which is areca nut flavored, areca nut carcinogen being sold as mouth freshener. So you can imagine how much money and how much power that this industry has. I wrote to James Bond, and the first time he acknowledged that yes, it was a mistake, and he reviewed the whole campaign. And that is how sometimes writing simple letters to such people can make a huge difference. I also decided to work in sensitizing the policymakers, the police officials, the members of parliament, the lawyers, the judges. All that is aimed at disseminating information about harmful effects of tobacco and sensitizing all stakeholders, including school, teacher, and medical societies, to work against tobacco. Thinking that so harmful and government is creating so much of awareness. What is the most sustainable form of awareness? The most sustainable form of awareness that I realize is early tobacco should have power. These are white mental photographs which are not connected. E-cigarette free awareness to every user. Must thank Ministry of Health and the Inaugural Center to work together and get those strong pictorial warnings which are very, very effective. Similarly, when you go in the cinema halls, you see those pictures or advertisement which is against tobacco. Those are shot in the Memorial Center and adopted by Ministry of Health. And again, this is creating huge awareness. This is leading to people quitting tobacco because the family members also see those images and tell the tobacco users in the family to quit tobacco. We also worked with the Supreme Court, very, very powerful evidence-based data that how tobacco and areca nut are very, very harmful. That led to on Gutka over India. The enforcement is not good, but on paper, this product is prohibited. While working on public health, I realized that surgeon, I was doing a lot of surgery, application, but what was recognized by the world was my public health initiator. And as a surgeon, I could have never got the invitation to speak in the United Nations. But because I was a surgeon, I was working in public health, I got the invitation to speak in the United Nations. So what I'm trying to say to young people and to the doctors, sometimes the world rewards you for doing things which you are not expected to do rather than the things that you are expected to do. This is really about areca. I want every doctor, every citizen to work on awareness against areca, which is a confirmed cancer-causing substance. Again, I'm talking about alcohol. Now, alcohol is a group 1 carcinogen. It gets converted into acetaldehyde whenever it enters the body. And I want every doctor to make this campaign successful
by not only using themselves, but also disseminating the information about people, about the people. And that is where this whole notion that there is a safe form of alcohol, there is a safe dose of alcohol, this is absolutely wrong, because alcohol is a mentioned, it is proven, and it is also known that there is no safe dose and form of alcohol, and this is an evidence-based data that I'm talking about. Similarly, there is a lot of confusion regarding the e-cigarettes. We must understand that e-cigarette is very, very harmful because it contains a toxic substance, a poisonous substance called nicotine. And this nicotine, if it is vaporized and given to the human body, it is not only addictive, but very, very toxic. Similarly, I must share this information with everyone that marijuana is something which is very hazardous. It is legalized in the US, but the Indian government, I'm very thankful that it has not legalized it for recreational purposes. For medicinal purposes, some use can be done. However, we must realize that most of the investment in the cannabis and marijuana industry is coming from tobacco industry, which sees a future in marijuana by selling yet another addictive product. This entire public health and being a surgeon of a reputed institution, I also became the director of the International Federation of Oncology Societies, which has around 40,000 members globally. It is a federation of oncology societies, means that it has 75 academic societies coming from 60 countries. What I'm trying to say, again, as a message, that if you work passionately in your profession, then it is not only a recognition that comes from the national level, but you get recognition from the international level as well. As soon as I became the president of the International Federation, I utilized the opportunity to disseminate the information about the head and neck cancer prevention and early detection globally. And I started the World Head and Neck Cancer Day through the launch. And today it is a very, very popular event with 300 events and 70 societies, 58 countries endorsing it. And it is done on 27 July every year. And my current assignment is as director of the Advanced Center for Treatment, Research and Education in Cancer, which is a unit of the medical center. And in 2 years, it will be the world's largest head and neck cancer with 1,200 beds to take care of the increasing burden of cancer in India. And we also have a research wing, which is for cutting edge basic translational research. We also have Center for Cancer Epidemiology, which is meant to work with the community and to work with the community to reduce the burden of cancer, early detection and prevention. Now, at the end 10 minutes, with whatever 30 years of experience that I have learned in my life, I have converted my entire lessons and my entire and experience that I have gained, that I want to give it to the budding doctors in the form of awareness. Let's see that the job because A stands for attitude. All of us must understand that the duty of patient are not doing any favor to the patient. In fact, the patient is doing a favor to you by having trust in you, allowing you to treat that person. Similarly, the human body, please understand, it is a nature's best creation. And you are privileged to deal with it. So be respectful to the human body. And whenever you are, wherever you are, you're the best you can. You can be a pathologist, you can be a microbiologist, you can be a preventive and social medicine person, you can be a surgeon, you can be an orthopedician. Whatever you are, give your best. And last, what is most important, it is not the degree which is really important.
It is your attitude which is important. If you have a good attitude, you will be a very, very good, successful doctor. If you do not have a degree, or even if you have multiple degrees, you can be an unsuccessful, unpopular doctor. The second E stands for balance. The balance means that today's world is full of temptation. If you see around, there are a lot of temptations: social media, alcohol, party, drugs, tobacco, other temptations. Now, if you want to be successful, you have to navigate those temptations. Stop getting distracted from them and just keep focusing on the goal. At the same time, I'm not saying that you should not do any of those sins and any of those bad things. You should do in moderation. Sometimes you all try to be the best. What you should try that you should not be a failure. And what I'm summarizing in the bottom is the difference between a successful person and others is not the lack of strength or knowledge, but rather the lack of this. If you have the desire, you will be successful. The important thing actually of all doctors is the compassion. Compassion is like flower without fragrance. And one thing that I have realized in oncology, it happens very often. It's a treatment protocol in a patient. And where my mantra is that when in doubt, put yourself in the patient's position and you will always get the right sum. And many times my friends, drugs can do what drugs cannot. And this is again a small saying that I'm sharing with you. The success of a person is not in how much wealth he possesses, but in his integrity and his ability to positively affect those around him. And I believe that compassion is one thing that really positively affects the people around you, especially the patient. The next important thing is dialogue or communication. Trust me, if you look at most successful people around you, whether they are in politics, whether they are in business, whether they are in engineering, they all have excellent communication skill. And communication skill is not only important for being a successful doctor, but also for being a good teacher and a good lead. And here again, let me repeat it, dialogue impacts patients more than your degree. And therefore, please polish your communication skills. Now, next, D stands for documentation. Trust me, having spent almost 30 years, many times we have been saved because of proper documentation. The world today is very, very tedious. Now we are going to live in a world where litigations are going to be very, very common. And therefore, documentation is very, very important. And it is going to save you in future. So please practice this process of documentation when you go into the clinical practice. F stands for fitness. And trust me, being a father of 2 children, I realize that a healthy mind lies in a healthy body. And unless you have a healthy mind, you cannot heal others. And if you are sick yourself, if you are not well yourself, you cannot really help anybody else to become better. And therefore, the best to bring out from the best from you, you have to be very healthy in your mind and your body. And for that, you should not have tobacco, you should not have drugs, you should minimize junk food, and you should have good exercise also wherever you have an opportunity. If you have all this, you will be a fit doctor, you will be a fine doctor. Many of the having gone through our undergraduation and post-graduation, I realized that sometimes the medical students, they run the life like a marathon race. Please haven't your life like a marathon race or medical profession as a marathon race. You have to understand that even if you do a marathon race or if you sprint, you get tired. What you have to do is that you run at the pace that you can and how much you can. For that, you eat well, sleep well, and that is how you will do well. The next thing is garment and get up. Trust me, I was trained with a doctor, my professor, who told me one thing that doctors, the patients look up to doctors, inspiration. And sometimes when your appearance and your clothes are not good, then perhaps they are not impressed by your clothes, your getup is the first impression that you get about the patient when they look at you. Whenever you are seeing the patient, your garment and getup has to be very, very appropriate. I told you about the communication, that how dialogue and communications are very, very important. One thing I must tell you, that a good communication means a good listener. And therefore, I expect all of you that if you are with the patient, try to listen to that patient. And if that don't stop them from the reason is that due to listening helps in diagnosis of common ailments and avoids unnecessary investigation and medication. The next is inquisite. Inquisite is very, very important age of a doctor because in the era where knowledge is freely accessible, it is challenged to know more than our patients. Many patients will come to the documents difficult for them to use the doctor knows less than them, and therefore you have to keep knowing it. If you inquisite, you find unsolved dilemmas, unsolved problems, hypotheses, and research based on what dilemmas, what confusions, what research lacunas are there in the community. So being inquisitive makes you a good doctor as well as a good researcher, and of course that is how you become a good teacher also. One thing I tell you is jovial is very, very difficult. Infection sometimes can be very big. The patients, the surroundings, the workplace can be really, really challenging. And therefore, being jovial brightens the otherwise gloomy world of ours. Friendliness and smile brings hope to patients and influence our team. And in last, I would say that according to me, there are two sort of things living does. One is Kriya and the other is Bhakti. Kriya means for your own happiness, your own sustenance, the sustenance of your family, every animal does, every human does, for themselves and for their family. So, what distinguishes a human being with an animal is not the Kriya. Karma means what we do for changing the life of others. So doctors, when they are treating patients, for that they are getting money, and that is their Kriya. That means that you have to go beyond the call of duty, something for which you are not remunerated, something which is selfless, and that is what makes you a human being rather than a professional. I would urge each one of you should find your karma rather than confuse your day-to-day practice as karma. And that is how you become a successful doctor and a good human being. Thank you so much, and I really appreciate your patient listening.
Good afternoon, sir.
Hi, good afternoon.
So my name is Manas. I'll be moderating the Q&A session. We've just played your recorded address.
Yeah, thank you. And sorry, I could not come because of some other commitment. My sincere apologies.
Thank you so much for joining us, sir. We now open the floor to the audience. Anyone with any questions, please raise them.
I can't hear you.
My name is Chinmay. My question is, data shows like only 12 to 15% of Indian women undergo cervical cancer screening, despite it being the leading cause of cancer deaths. Why has the awareness not translated into action? And how can SP's future doctors can bridge this gap?
Can you repeat? I'm so sorry, I couldn't hear. Maybe because of the network issues. Can you repeat that?
Data shows that 12 to 15% of Indian women undergo cervical cancer screening, despite it being the leading cause of cancer death. Why is the awareness not translated into action? And as future doctors, how we can bridge this gap?
Perfect. So let me understand the question. You are saying that why such less number of cancer patients avail the screening program when it is so simple, easily available, and how doctors can bridge this gap between how much people should get the screening and what is actually happening. Is that the question? Thank you. So there are three cancers: oral cancer, breast cancer, and cervical cancer. These are the three cancers for which Tata Hospital has done extensive studies and found that for cervical cancer, only visual inspection by acetic acid is the diluted vinegar. For oral cancer, visual examination. For breast cancer, clinical breast examination. These are the three modalities by which you can do early detection of cancer. And imagine one requires clinical breast examination by the health worker. The other two require visual examination by the health worker. I have not talked about any technology. I have not talked about any expensive thing. I have talked about eye and the hand. That too of the health worker, people who are 10th pass or 12th pass. I have not even talked about doctors. So such a simple remedy is available for common cancers in India, yet only less than 3% of the population is availing this service, though government is rolling it out. I would suggest that each one of you can indulge into opportunistic screening. Opportunistic screening means that there are patients who will come to your clinic for non-cancer related ailments. If someone is a tobacco user and he has come to you for throat problem or ear problem or stomach problem, take the opportunity to counsel them about the harmful effects of tobacco and do the oral examination. Similarly, the gynecologist can do the cervical cancer screening when the women have come to them for unrelated diseases. Similarly, for breast cancer also, they can create awareness. So that is something that you can do in your clinic level. Now comes social awareness. And in the social awareness, I would urge all of you to utilize your talent. Go to the community, urge the women to come forward and get the screening done, which is free. So that is one aspect. If you have done the awareness and if they go to the primary health center or the district hospital or the medical college, they'll be misguided. This may be a problem. So what you should do, that you should also, this is what we call advocacy. You meet the local district hospital, the chief medical officer, the civil surgeon, tell them that it is their job to create awareness and do the screening program. So you are absolutely right. It is a multi-pronged approach. You as an individual can do something, and then you can do the advocacy and engage more people to do the similar thing.
Thank you so much for your answers, Eva. We have a few questions from the audience.
Good Good afternoon, Dhruv. Sir, in the oral cancer, sir, but still there has been many programs that are done to quit tobacco. But what, according to you, is a practical evidence-based method that has actually caused patients to actually quit smoking and quit tobacco?
That's a very good question. If there was such a simple answer that I could give, I think tobacco would have been a history by now. Because can you imagine any product in the market which has a graphic oral cancer picture on it, and it in its own admission says that it causes painful death, yet people are buying it? And surprisingly, if awareness was the only key factor, then doctors should not be smoking. And since you are in JIPMER and around 20% of the medical students also smoke and they have tobacco. So awareness is not the issue because doctors know everything, yet they are taking tobacco and alcohol. What is most important is that we have to stop initiation of the tobacco use. And by initiation means that we have to go to the schools and we have to empower the children, make the children aware that they should not pick up the tobacco. Once they do not pick up the tobacco, then your battle is won. Once people are addicted to tobacco, it is the most addictive substance currently known in the world, and there is no drug currently available which can make people quit tobacco. And that is why, even in the best centers in the world, tobacco cessation clinic, the success rate is 10% for a period of 6 months. But overall, if you look at the population level, only 3% of Indians are able to quit tobacco, that too after getting fatal illnesses like COPD, heart attack, or cancer. So there is a very famous saying, cancer cures smoking. Thank you.
Thank you, sir.
Sir, good afternoon, sir. I am Siddharth, sir. Sir, I have a question, sir, futuristic question. What is the future of AI in cancer diagnostics, sir?
See, AI is going to change everything. Be prepared. It is going to affect the medical profession also. And I'll give you an example. The example is that for a biochemical report readout, you don't need a doctor. The machine can tell you what is abnormal and what is normal, and the patient can directly go to the physician. Maybe the microbiologist and the biochemist will not be so much in demand. Similarly, the radiology, the pathology, we are already, Tata Hospital is already working on artificial intelligence in diagnostics. That means in radiology, 80 to 90% of the routine ailments can be diagnosed merely by CT AI. Similarly, pathology. In pathology, the technician will prepare the slide, do the HND staining, and it will be subjected to the AI, and then you will have the answer whether it is carcinoma or not based on the digital tools that we currently have for AI. So I'm sure the whole scenario, the paradigm of medicine is going to change dramatically. Now, how it will unfold, we do not know. But let me assure you one thing. Whatever we people may say, there is nothing more important than the human touch. And if everything can be replaced, then perhaps some parts will remain, and that is general physician, general surgery, general medicine with specialization, where the treatment decisions are not decided by the machines, but it requires a human interface between the patient and the doctor. And that will take at least a decade for me, rather than patient sitting in front of a machine getting the prescription going to the pharmacist, buying the prescription drugs, having it at home, and then again going to the machine and telling that whether the benefit has happened or not. That reality is more of sci-fi, but I don't think it will happen for 10 years. So all of you who are doing MBBS, be assured for 10 years you are secure. After 10 years, I do not know what will happen.
Thank you, sir.
Hello, sir. I'm Janani. I'm a psycho-oncologist. So looking into the perspectives, like how medicos handle all the cases, what is your opinion about seeing head and neck cases, which is very repetitive, and it's very monotonous too, right? Even though they get curative intent treatment, they again come back with recurrence. And how do you see the cases, sir? So it's just your experience.
So there is nothing repetitive. Every student is different. Every human is different. Every patient is different. No disease is same. And that is what is called biology. And that is what is called response to treatment. Though I have the same stage 1 cancer, same stage 2 cancer, two different patients, they behave differently, they respond to treatment differently, their outcomes are different. So there is no monotony. But what is more important, that if you do the same thing every time, you become the specialist. Rather than being a generalist, that I treat all bodies cancer in Tata Hospital, what we have seen, that if you do only oral cancer for 10 years, the survival of that oral cancer is better than a group which is not treating oral cancer regularly. Similarly, there are a lot of studies that patients who are treated in high volume center and high degree of specialization, they have better outcome even though the same treatment is given to all of them. The reason is that outcome is a culmination of surgery, radiotherapy, chemotherapy, post-operative care, rehabilitation, supportive care, and all that together. That happens best when you have a disease based group rather than a general group.
Yeah. On another question. So we have so much of advertisements coming up on tobacco causes cancer. And when we see in practical setting, not just the patients, even caregivers come up with saying like, yes, tobacco causes cancer, but not for me. So where do we lack the gap? So like, how can we bridge the gap to make awareness more effective? We can communicate in a more effective way.
So one aspect is that you are saying awareness caused by the government through the cinema hall or cigarette packets. The other is all our Bollywood celebrities in television, they are promoting pan masala. So on one hand, somebody is saying that tobacco is harmful, but a larger people who can influence our youth are saying that pan masala is a lifestyle in the name of ilaichi and rajnigandha and all that. Even in the film festival awards, you see all these Bollywood and celebrities are doing it. Similar thing is happening for alcohol. All the cricket celebrities, they are promoting alcohol. So the problem is that the youth are not listening to the awareness that you are trying to create by showing those gory pictures and harmful effects of tobacco. They are listening to their icons, which are Bollywood celebrities and celebrities of cricket, and they are picking up the habit. Once they pick up the habit, whether it is tobacco or alcohol, they get addicted. And once they are addicted, they are not able to quit tobacco. It's a very common thing that quitting tobacco is very, very simple. I have done it every year because they try every year, they fail, and when they fail, they enter the phase of denial. And that phase of denial is cancer will not happen to me, cancer will happen to someone else. I will not die, somebody else will die. The same thing applies when the children, they drive the bike at 100 kilometer per hour without a helmet. They think that they will not die, somebody else will die. But it's just a probability. Everybody can die if they are using tobacco. Some people use that That man was using tobacco, he didn't get cancer. That man was not having tobacco, yet he got cancer, he did not get cancer. All kinds of myths are created, and this is in psycho-oncology, and in psychology it is called denial. You want to deny the evidence because you have given up, and you want to justify in your mind that what you are doing is right. Don't give up, Jaini. Keep doing hard work by counseling people to quit tobacco and alcohol. But concentrate on medical students as well. There are a lot of medical students who on every Friday evening and Saturday, they are going for alcohol party. And alcohol is a group 1 carcinogen. Please Google and check. It is not some kind of sermon that I'm giving here. It's a confirmed WHO IR monograph based on the animal evidence, human evidence, and population evidence.
Thank you, sir. Thank you.
I have spoiled many people's party tonight, I guess.
Good afternoon, sir. My question to you is, when did you figure out that surgery was your calling, and how did you figure out it was surgical oncology only?
See, these things are very personal. Nobody knows you better than yourself. So when I finished my third year MBBS, when I was doing the rotation in Department of Surgery as a regular rotation, I realized that surgery was my calling, and I couldn't have done anything apart from surgery. The reason why I chose surgery, this is the only profession where you finish the job as soon as you start it. That means I go in 45 minutes, 1 hour, 2 hour, I finish my job. I do not play with the statistics that I give you a drug. You may respond, you may not respond. But when I do surgery, I come with the complete response every time. And the beauty of surgery is that it is a teamwork. I cannot work alone. I need my assistants. I need my nurses. I need my OT boys. I need my pathologists. So people who have leadership qualities, please don't confuse that I'm trying to sell surgery to everyone. I'm just saying that I realized that I wanted to work as a team, and there was no other specialty than surgery where such a team can work together.
Hello, Dr. Pankaj. I'm Dr. Veena here. I work in Gynec-Oncology Division of Obs-Gynae Department here.
Hi.
Hi, sir. I had a short stint in Tata Memorial in 2015. I was there for 6 months in Gynec-Onco Department. So I had seen you live a very humble and down-to-earth life over there. You've been an inspiration since then to me, actually. Your passion for prevention of cancer is infectious, sir. I really work a lot towards cervical cancer prevention here. And when one of the students asked about why there is no uptake of screening methodology, I can tell some practical pointers. Women are extremely conscious about their bodies and they don't like to expose themselves in front of strangers. So we are doing a lot of research here in terms of self-screening. But the only problem is we need a lot of funding for that because HPV DNA testing is extremely expensive. Via would have been extremely easy for us, but that also needs women to come and expose themselves in front of us. So we're really having a tough time. We go for camps and we hardly have any attendance. It's actually a very dismal state, I feel, but somehow we'll try to do something, sir. You are an inspiration for me in this particular regard. And thank you for a very fantastic talk, sir. Very hard-hitting truths and very hard-hitting advice for our students from your side. Thank you so much.
Thank you. You can try self-sampling. We have done multiple studies to demonstrate that self-sampling of HPV is very, very possible. And yes, the cost of the testing is something that we have to overcome. But in an institutional setting, if you can do the HPV testing in your own department, in the preventive oncology or the gynecology, get all the samples there, get some funding from somewhere and do the HPV testing. It can be a good study also. Forget about life saving, that what is the compliance to self-sampling and what is the positivity rate in that particular population. And then once that data is there, perhaps you can write up a bigger grant to go again and do some screening program in the community.
Yes, sir. So we'll do that, sir. Anyway, already some studies are going on in a smaller level. We are even testing for HPV DNA in the urine samples now. Because they're not coming forward to self-collect also. They're scared to put a swab into their vagina, hurting themselves kind of thing. So we are working on it, sir. Thank you. Thank
Perfect.
you.
Thank you. Thank you.
Bye-bye.
Thank you so much for joining us today. So we have a few more questions, but in the interest of time, we unfortunately have to bring the session to an end. Once again, on behalf of JIPMER, on behalf of the Connaissance organizing team, I'd like to thank you so much for making time and joining us remotely, even though you couldn't be here with us today.
Thank you.
Round of applause for Dr. Pankaj, please.
Thank you.
With that, that concludes the opening session for the first day of Connaissance. I thank you all for being a part of this. This is the largest attendance we've had since we've begun conducting this event. There were some really insightful questions being raised, and I could see that each of our speakers had a profound impact on our audience. Thank you all for joining us. I hope to see you again for tomorrow's sessions. We have some interesting lectures and panel discussions and debates planned. I hope all of you will be joining us if you don't have other commitments in terms of workshops or presentations. We have on tomorrow's roster, Dr. G.V. Rao, who is the Director-in-Chief of Surgical Gastroenterology at the Asian Institute of Gastroenterology. We have an interview with Dr. Marjorie Kanikar, and we have Dr. Suman Chakraborty, a professor of mechanical engineering at IIT Kharagpur, who's going to talk about interdisciplinary projects in medicine and engineering. Thank you so much for joining us. Lunch for delegates is arranged in common mess. Thank you.